All right. Good morning, everybody. My name is Dave Mayer. Honored to be one of the co-chairs of the Provider Supports Subcommittee. I am the Early Childhood Education Director at the Office of Catholic Schools with the Seattle Archdiocese, and really excited to be here today alongside my other co-chair, Julie, who will be introducing herself here shortly when we get to kind of our next section of the day. If you've never been to Provider Support Subcommittee before, welcome. And for those that have joined us often, welcome back. We're really excited for a great and engaging agenda and topics today, and excited for all of you to participate in the conversation. At the beginning of the meeting this morning, we're going to go through a few kind of administrative things before we get the meeting started in earnest. But I just wanted to let you know that as we do go through these things, we are expected to be joined by Secretary Tana Sen. And when she does join, we will stop for a moment with these administrative pieces and have her have the opportunity to be able to connect with us. So that's why I may have a stop in the middle of some instructions. So let's start first with our interpretation channels. We have two wonderful interpreters with us today, Mia and Norma, and there are a couple of instructions on the scene or on the screen for you to follow in order to have the correct interpretation channel for this meeting today. So if you could please follow the instructions, you're going to click the interpretation globe icon at the bottom of the screen, and then you'll click the language you want to hear. If you do have trouble with any of this, we have some great resources from our community engagement team that are uh, that are here. And if you put your question into the chat, they may be able to help you troubleshoot. But please click the interpretation globe icon and then click the language you want to hear. For those that are joining us today that will be presenters, this will be your first of multiple reminders to speak in um, uh, I always hate to use the word slow, but in a good cadence, to not speed up too fast. And so our interpreters have the opportunity to do good interpretation for those um, that are here listening in other languages. All right, we can move to the next screen. The other thing is you may have joined from a phone or you may have joined from someone else's Zoom account. I do see quite a few names on there, so this is looking quite good today. But just a couple of notes about how to change your name on Zoom. Our instructions for that are also on the screen. In the meeting controls toolbar, click participants, hover your mouse over your name, and then click more, click rename.
What is on the headphones?
A pop-up box will appear. In the pop-up box, enter your display name and click change. If you do have the opportunity to put who you are affiliated with, that would also be great. So people on the meeting today know who is joining us today. So if you are with DCYF, you can put that. If you are with a center, please put that. If you're with a family home, just to be able to have a good identification of who's with us in the room today and where you have joined us from. So, again, any questions about how to change your name on Zoom, you can put that in the chat, and we have some folks here that will be able to help with that troubleshooting. All right, Jessica. All right. And now we are going to hop into our introductions today. I know that we're putting some information next to your names, but let's do this a little bit more formally. So, in the chat, because we have a good group of people today, but in the chat, if you could please share your name, where you're located, what your role is, and in honor of Child Care Provider Appreciation Day this month, share one word that describes a child care provider who has made an impact in your life or community. So let's take 3 or 4 minutes to get those introductions into the chat. So again, you can see it on the screen, but your name, where you are located, your role, and in honor of Child Care Provider Appreciation Day this month, share one word that describes a child care provider who has made an impact in your life or community. As we are waiting for folks to get those into the chat, just a couple of other notes. Participants are welcome to bring their own AI generated meeting notes, but please know those notes are created by AI and do not come from DCYF. If you do need official meeting notes or translations, DCYF provides all materials and translations at no cost. And you can reach out to our community engagement team for questions. And please be mindful of our community agreements and our limited time together. Please keep your answers or input as brief as possible and on topic. All right. We have some great things coming into the chat now. So I just want to welcome everyone that's been sharing your introductions. Julie in Kitsap County, center owner, which is fun. Oh, that was your one word. I thought being the center owner was fun. So um, it's good. Erin from DCYF Community Engagement, located in Seattle. Her word is advocacy. We have Sandra Nelson, welcome. Southeast Seattle, Executive Director, Huggable. That's awesome. Lisa from Yakima, in-home childcare owner, mental health support. Michelle Aguilar from Vancouver, CCA Regional Coordinator, nurturing. Eva Gonzalez, owner, home provider, Pasco, support. It's really cool to be able to flip through these and see just the amazing amount of geography that's joining us here today as well. Lindsay with the YMCA of Snohomish County, Early Learning Director. Work is reliable. Good to see you, Lindsay. Thanks for joining today. Paris Thompson, Public Health Nurse at Snohomish County Health Department. Patient. Andrea Eli, who's going to be joining us or will be doing our first presentation today, the Deputy State Fire Marshal. Patients. Okay. Lois Martin from Seattle. Resilient. These are great. Thank you all for sharing these. And welcome to everyone who has joined us today. Oh, Jamie, I liked your answer. It's good. Susan Brown, welcome. Uh, Founder and CEO of Kids Company Catalyst. All right. Well, you will all have the opportunity to continue to read through these as they come in over the course of the day. And again, I just want to welcome those that this might be your first time to provider supports, and also welcome to those that have been here many times, and welcome back. And so, Julie, I think as we wait for Secretary Sen to join, let's get started with the meeting material review, if that works for you.
Great, thanks. So, I just want to first apologize to everyone because meeting materials were not sent out, and we will make sure that that doesn't happen again. But if we could have the feedback loop that was sent over by Katie up on the screen, then we can go through that. There were a lot of questions from the prior meeting that were responded to from the department. So I see you put the link in. I'm still hoping that they can go up on the screen, as not everybody may be able to view them, especially if they're on the phone or something. Okay, so I'm going to go through it question by question, and I'm going to hope that yours matches what I've got here. But one of the questions was, how will people apply for the experience waiver and who will be verifying? And really the gist of that answer is they don't know yet. They're working on it. And there's a question later about, will the experience waiver be applicable for ECAP? And the answer is no for that one. But there is a professional development plan that everyone, including ECAP, can use that gives them 5 years to get their qualifications. There was questions about the WACs and how we would find out if there were WAC changes coming. Oh, and I see the Kennewick thing, right? It said they had an office in Richland. It also talked about how not, if licensors are busy, it sounds like the office might be closed. Maybe there's not a secretary or something in that office. So you would have to contact the office directly to find out if they're open or when they will be open. So about the WAC changes, there are WAC changes that seem to always be in work. There is a page for that on the DCYF website that you can follow, you can read up, you can subscribe to the Gov emails about WAC changes. And there's more information coming about the new NRM that they're going through, which obviously is going to look very different than last time, which was 2019. There was a question during our last meeting about what was the benefit of having family input related to staff qualifications. And the answer in the feedback is that the staff qualifications work group has decided not to move forward with incorporating family input. So I think that's an important one because that was a pretty lively discussion there. Regarding staff hours for participation on this meeting, this is something that DCYF is in discussion internally and with the co-chairs. We have a meeting scheduled to have a conversation about that, and we will have to get back to you on that. Let's see, there was questions about the subsidy, but I'm just going to hold off on that because we have a section where Nicole Rose will be talking about the recent webinar that included discussion about subsidy. Let's see. We've got, there were questions about the workforce data collection. What's the point of the group? What changes do they foresee? What is the end goal of the group? There was some information on that. Let's see. The work is a joint effort between DCYF and the Office of Accountability. The primary goal is to support forecasting of workforce needs, such as training and coaching. The purpose of the presentation was to best describe the limitations of the data, clarity of active workforce definitions, and what information people would want to see and how they might want to use it. There's going to be more information coming on that. So I imagine we'll be getting regular updates about that. Okay, let's see. There was discussion.
Julie, before you move on, Nicole
Mm.
has a
Yes.
comment.
Oh, I'm sorry. Go ahead.
Oh, no, you're fine, everybody. I just wanted to let you all know that Secretary Sen is here as well.
Oh,
So
welcome. I hadn't looked
when
up.
we're ready to transition, she's here.
Absolutely. Dave, go ahead.
All right, well, we will transition right now. That's awesome. Hold on one second. Um, just this is a great opportunity, but in honor of Child Care Provider Appreciation Day, we're really grateful to have Secretary Tana Sen join us with some morning remarks, recognizing the essential role child care providers play in our communities. Welcome, Secretary Sen.
Thanks so much, David.
Yeah.
It's so great to be with all of you. I absolutely love talking to childcare providers. All of you guys know that. And it's so wonderful to see so many familiar names and faces. And I'm just excited to be able to say a deep thanks and deep appreciation to you all um, today, and really emphasize and wanted to make sure everybody felt really, really good last week for Provider Appreciation Day. We filmed an incredible video at the Multicultural uh, Child and Family Center in Tacoma and shared that out. And our staff have just, been all about tons of thank yous. It has not been an easy year. I mean, there's no way to sugarcoat that, right? You guys have just been taking it from the left and the right, and it breaks my heart. You guys do such critical work to keep our economy going, obviously to help parents go to work, but to like create this future for our kids and make sure they're ready for school and have got the social emotional learning and the compassion and everything that they need to be successful. So it's just very frustrating. People were balancing being a small business and doing the business side with taking care of our kiddos, and that's a hard balance. That's like left and right brain also. So it's a lot of hard work, and I just want you all to know that I certainly recognize that. DCYF recognizes that, and we are so grateful for everything that you do and that you'll continue to do. And again, even as it's harder to probably make a living, it's harder to just deal with everything. And then you get some of the political and publicity flack. And, it's hard for me and I'm used to it, right? That's been my job for 15 years is to take political flack, but that's not yours. And so again, just this year in particular, thank you. I mean, just deep, deep thanks. So in the chat, we've also put a link to the video in case you haven't seen it. And then we also want to share from all of our staff a brief slideshow that people put together thanking everybody. So again, just deep, deep, deep thank you. You truly make the economy go round. There's no doubt about it. There's no way to sugarcoat that. So thank you.
Thank you so much for joining us this morning, Secretary. It was awesome to have you here and to be able to share these words with the group. So we really, really appreciate it.
It is my pleasure. And again, so wonderful to see so many faces that I haven't seen in a little while. And of course, know that you guys are all still working hard and engaged in this space because of course you are. It's your drive, it's your mission, and it's your calling. So thank you. Good to see you all.
We built a $49 garden hose nozzle that
Okay, well,
Awesome.
that was nice.
Yeah, thank you for sharing that. Cool to see the different unique ways in which the different departments were showing their thanks in their pictures. So really cool. Thank you.
You're welcome. Take care, everybody. Good to see
All
you.
right. Thank you. All right, Julie. Tough transition. Back to you.
So there were updates on ECAP, and I do apologize. The document that I have is not the same as what y'all are seeing. I'm just noticing that, so mine's a little out of order. Okay, so on the ECAP expansion, let's see. Like I said, they can use the professional development plan. The experience waiver does not count. There were questions about the benefits to providers, being that staff calls are so different. Oh, and that's where they talked about the professional development plan. One of the questions, people will start to investigate ECAP, and there's a perception of the requirements being overwhelming. So there was some discussion about that, but it comes down to, I think, working with a contractor might be the better step for some folks. And I think like one of the local ESDs, I think is yeah. So they did put a link. I know you guys, Jessica, you guys will send out all these documents after the meeting, right? So there is a link in one of the documents that says ECAP Neighboring Organizations Program Finder. So you could use that. Anyway, where is expansion projected to occur? And some other questions about expansion. So the program is currently offered in multiple settings, and we believe it's important that the model continues. Let's see, the expansion fully leverage our mixed deliveries. Okay, that's not quite the answer. There was a question about how to fill up the 10,000 slots. Is there a study? How are ECAP slots expected to be utilized if there's no support for buildings, facilities? Okay, that's all right. Let's go to the feedback on that one. DCYF is currently conducting an ECE facilities exploration project to better understand the facility needs. Implementation plan will be made after June 2026 that will identify the number of buildings that will be needed to accommodate the number of children that may need care. Let's see, appropriations for the Early Learning Facility Fund enacted in 2017. Let's see, will that be opening up again? Trying to skim that and see. Well, there's some links in there, more information with a link to the Department of Commerce website. That's all I've got for that. Let me look up for a second here. Early learning budget and legislative updates. Okay. Yeah, okay. So Nicole's going to go over the subsidy stuff during the later section, but there will be a subsidy increase this July is what it says, July 1st, although the exceptions are removed for the counties listed on the screen, Benton, Clark, Walla Walla, and Whitman. And then and then they'll reassess next year. Let's see. Will these cuts impact DCYF staffing levels? Changes to staffing are expected as realignments are made to meet both resources reduction and agency goals. Okay. Okay. All right, so licensing updates, we did talk about that already. There is a website for that, and you can sign up for the Gov, where you get emails about licensing updates. We've also had some internal discussions with, myself and Dave and some of the DCYF staff about adding something to a survey that goes out to you all on the committee, providers, that would ask if there's any WACs that you're running into frustrations about interpretation or whatnot. And maybe we could discuss one of those per meeting. It would be a slow thing. It would be a slow roll, right? One WAC per meeting to really discuss. And maybe an example of that would be, I often hear people say, well, why are the brooms in the classroom in the same WAC and prohibited like a power tool? So that might be something that we bring to this meeting. I don't think there were other agency updates. I know there was some kind of statement from the governor. Is that something that, okay. Proclamation about the Provider Appreciation Day. Okay. Let's see. Yeah, we don't have other updates other than that. So that would be the end of that. All right, so we have time for questions about any of the feedback or things that were not addressed or still need to be addressed. I will mention there are things in the feedback that are written up as action items, and they're not always brought back with an answer. And so I'm wondering if maybe CE needs to either reframe that or make sure that we're getting responses to the action items. That was something that I noted in the feedback. So I want to open it up and see if there's questions that we can collect for next time. I also want to mention that we are, Dave and I are the co-chairs, and Katie has stepped down. So we are in need of a third co-chair, a tri-chair type of thing. It can be a lot if one of us is going to be on vacation or has to step away. So we do need a third person, and we will, by the July meeting, there will be an application shared like in the chat and with the other documents that get sent out to you all, an application so you can apply. And then we can have a discussion about here's who applied. And typically, at least when we first started, this was something that the group would then vote. So hopefully that's still the way we would approach this if we get applicants. So anyway, but I think we have covered everything, and we would move on to our first topic, but I want to find out if we have Andrea Eli here already. If not, then we will be taking oh, we have a thumbs up. Andrea is here. And
hi there.
And I know that I've said your name wrong. I had it written down somewhere. Can you tell me your name again?
Yeah, it's Andrea Ely.
Andrea Ely. Okay. So we are so excited to have her here today. She is the Deputy State Fire Marshal from the State's Fire Marshal Office, and she's going to provide an overview of fire and life safety requirements, including the roles of local and state fire marshals and how these requirements apply to childcare settings. Thank you for
Yeah,
coming today.
thank you so much. I don't know if you guys can all see me right now. I was hoping to share my screen, and I
Yes.
understand I have some helpers today in the chat. So I'll try and do that now here and see if we can get that going.
And just as people, if you were joining, just a reminder that we do have two interpreters with us today that are doing interpretation. So just watch the speed of your presentation, and also for anybody that has comments as well.
Wonderful. I will do my best. Okay, let's see if I can get this going here. All right, can everyone see my screen okay?
Yep, it looks good.
Yes.
Thumbs up there. All right. Wonderful. I'll try and go a little bit larger there so we can see everything.
It looks fine.
Okay. Well, good morning. My name is Andrea Ely, and I am with the State Fire Marshal's Office, and I'm a Deputy State Fire Marshal there. Just a little bit about our agency. We do quite a bit of things for the state of Washington. You'll see some of these topics here coming up. All the stuff that is on here is awesome, fun stuff that we get to do, but we are going to focus today on fire code inspection, obviously for child cares. And I'm just really honored to be here and to meet Secretary Sun and everybody that you have been doing such an amazing job out there, being the core value of our communities. I can tell you this, it's one of my favorite things to do is inspect childcare facilities. Out of all the things I get to see, it's always been a joy. A little bit about myself. I have been in government, public service for approximately 24 years now. I've had the benefit of being a volunteer firefighter for 6 years, as well as a fire investigator. I come with a lot of background, and I'm hoping today I can share with you guys some tips, tools, some things that I've noticed from the field doing inspections and through the process of childcare approvals. Hopefully, you'll be able to take away some good information. If I don't know the answer to a question, I have some really great resources going to my chief deputies, as well as a lot of other friends in the field that can assist me. And I will be happy to get any information for you if I don't know. I'm usually the first to say it. I don't know. I'll let you know when I find out. So, yeah, let's dive in today and talk a little bit about our agenda. Being that there are so many things in the fire code and so many different things that can affect your application and licensing approval, we're going to start kind of general and kind of dial down at the end. I do have some time set aside for you guys, hopefully to answer some questions. If you guys have specifics or things that you have experienced. So we'll start with a general outlook and then kind of dive in. Looking at who is in attendance today, some of you have probably been through several of our processes for applications, and others of you are kind of involved on the community side, education side, and I really hope that we can kind of have some good dialogue about some of the things that I've experienced and hopefully will help all of our providers across the state. So the first thing we're going to chat about today briefly will be about why we have fire and life safety inspections. We do have some fun discussion about that. And then we will move into some definitions and code terms. Being that we have several, I didn't put too many of these in here. I wanted to put just a few that you will experience when we come to visit your sites in the process of licensing. And then we are going to talk about authority. And that one is a very complex topic. I will do my best to explain everything that I've seen as well. But mostly it will be a lot about who is in charge of helping you become licensed and what authorities that they have. We'll dive into that too. That's going to be a big one. Then we'll talk briefly about compliance and what that means, the things that drive compliance. There's, again, several codes and RCWs and WACs across the state that the state of Washington is required to inspect and review. So we'll talk about that briefly. And then we are going to go into some rules that mostly our office and DCYF per our contract kind of follow. Some of these are just best practices, but mostly they are things that we need to do to be able to help you get where you would like to be. And hopefully we'll have some feedback if DCYF has to jump in on some of those, they can as well. Then we're going to talk about your timelines. Timelines are a very big topic right now when it comes to childcare licensing. We normally see a lot of licensors come in and they're like, we need to open yesterday. So we are going to talk about what our timelines are in regards to our contract agreements as well, and what that looks like for you. We'll discuss some challenges that may come up. I try and give as much information of what I've seen and experienced, because as I said, we definitely know there is a need for childcare services in the state. Everywhere I've been, there's just seems to be more and more licensing that's being applied for, because we have a lot of really great hard workers in the state of Washington that really depend on you as providers and us as public servants to do our due diligence. So we'll talk about those as well. And then lastly, we'll get into some inspection expectations. This is going to be a little bit about what it's like when we arrive and what to expect. We do have kind of a pretty basic rule of thumb when we come out. It's very typical for most of our inspections, but there's various types of inspections that we can do. And we'll talk about what that will look like for requirements for you when we do arrive. And at the very end, we'll have some time for questions and discussion. And again, I will do my best to answer your questions. As each of you, as providers and those that are affiliated as administrators in this field, it's very hard to get very specific answers when it comes to code and standards, because every single childcare is unique. Just like the way you have a child walk through your door, they're as unique as they can be. Childcares are very similar, but I'll do my best to kind of give you the general codes that may apply to your facilities and things that you may encounter. So we'll have some time for that as well. Okay, well, let's dive in. So let's talk a little bit about why we have fire and life safety inspections. That's what FLS stands for. We are humans and we are creatures of habit. So what that means is we leave the way we came in. This poor young lady who's just trying to exit the building is going out, well, attempting to go out windows, which don't work. But this is kind of why we do what we do. In emergency situations, panic, emotional distress, and trauma can really affect people in different ways. And normally when people come into a building, they leave the same way they came out. They don't necessarily look for exit signs. It could be due to stress. So we definitely have a kind of a theory in the fire service, which is, people ask me all the time, what do you do as a deputy state fire marshal? What do you do as an inspector? And I tell people I inspect for human behavior. We are always looking out for those that are within your buildings to identify hazards that will directly impact you and all of your occupants. You guys have absolute precious cargo in every one of your centers and every one of your residential child cares. They are important cargo. So we take our job very seriously when it comes to inspecting your building. Does anybody wonder or know why licensed care is the second most regulated industry in the nation? And if some of you haven't heard that before, it might be surprising, but licensed care facilities are highly regulated. Feel free to jump in on the chat if you think you know. We have so much liability in what we do in licensed care. And I say we because you as providers have a responsibility to your families and children. And we as inspectors have a responsibility to you and your occupants as well. It's kind of a joint effort, if you will. But yes, vulnerable populations. You guys are caring for those that are littles that are sometimes in need of assistance. We inspect facilities like hospitals and licensed care for assisted living. We have several areas that vulnerable populations exist. And when we have emergencies in those areas, we have a higher risk of harm and loss, and that could be for property and life. So that's really why we do what we do. We see quite a bit in our field oh, did they have to write that down? It's just a power strip or an extension cord. Well, every single one of the citations and violations that we write in these reports, they're kind of like the fire that didn't happen. And we can't really put a number on that. We can put a number on how many fires we may have in a specific area, but we can't put a number on how many we prevent. So we look at those as wins. Every time you put effort into making your building and your childcare safer, we're doing the right thing, and that's the best part about it. So that's why we are here today. That's why we talk about this stuff. All right, so let's get into some definitions and code terms. We are going to go over just three today because these are the ones that are pretty much the general overlook. Let's see if I can get here. The first one is called the AHJ. This acronym stands for Authority Having Jurisdiction. Jurisdictions can be boundaries that are physical. So you have your local jurisdictions, counties, cities, towns. But authority having jurisdiction can also apply to organizational. And that means if you're operating as a childcare, you have jurisdictional authorities. Our next one is ICC, and that stands for International Code Council. Nationally recognized codes are pretty much what we put all our foundation on. The International Code Council began kind of in the United States around the 1980s, kind of spread throughout the states after that, and most of the states in the nation will follow these codes. Just below that, you can see a picture of the IFC. That's our 2021 edition of the International Fire Code. Many of our citations in your reports that you receive are going to have this reference. So ICC codes, there are several. There's plumbing codes, building codes, mechanical codes. Several of these ICC books, which mind you, if you ever want a really good nap, be an awesome read for you. They are very large books with lots of information on. And we'll dive into a little bit more about codes and standards in the compliance section. And then our last one is called ITM. ITM pertains to you guys in the sense of your responsibility for inspection, testing, and maintenance. And you guys have a lot of responsibilities as is. You specialize in some really amazing things for childcare. So what we do is we come in and make sure that your building system services are getting the proper inspection, testing, and maintenance. So when we use this term, we need to make sure and just remember that they're usually involved with your facility, making sure that the systems that some of you pay a lot of money for are maintaining them and that they're functioning as they're intended. I usually reference this in a lot of ways, but if you were to buy a car, you wouldn't avoid an oil change, not unless you want a really expensive repair. So these systems, very complex, engineered, they do require quite a bit of work to upkeep. So we'll talk a little bit more about that as well. Okay, so now we're going to dive into authorities. And before I do, just so you know, if you do have questions that kind of pertain, feel free to put those in the chat. This section is going to be a little bit complex, so I feel like we might have a few of those. And whoever my moderators are, feel free to interrupt me and say, hey, we have a question on this, because these do get quite complex.
There was a quick one in there that people are just now intrigued to learn about. So you had said that the childcare was the second most regulated industry. Do you know what the first is? Because there's some guesses that are now happening in the chat.
Oh boy, I tell you, that's a fun one. Yes, you're actually, that's a great question. Sites like nuclear and hazardous materials, hazmat facilities, are the number one. They have severe code regulations, and I always enjoy going to those facilities because they are very tightly, tight ship, as they say. So yes, but just below that, you will see licensed care, because again, we
So,
have a lot of people usually in a building that requires a lot of regulation.
so we can all be comfortable. It's nuclear reactors and then childcare. That's
And
perfect.
childcare, yeah.
Okay.
Licensed care is definitely up there, and people are just like, "Wow, you guys are so intense sometimes," and I'm like, "Well, we kind of have to be." But yeah, again, so much precious cargo. We got, I love going to hospitals and assisted living facilities because, these people like you are taking care of our grandmas and our grandpas and our veterans. All of those things are just so important for our community to thrive. And so, but yes, great questions, great questions. Okay, so let's talk about authorities. AHJs come in a lot of different forms. Counties, cities, and towns are kind of the most common when you think of authority having jurisdiction or jurisdictions. We call these the locals. Your facilities, depending on where they lie, will have a lot of regulations that come with a county, a city, or a town. And since we have county commissioners, city council members that decipher what your county and community will experience with codes, it's really important that you are aware of those jurisdictions and who is your authorities. We also have local fire department officials. A lot of childcares may not know this, but your local fire department officials could be a fire marshal. It could be a fire chief. They have authorities over facilities in their jurisdictions as well. So you may be in a fire district and you may get a fire chief or a fire marshal that stops by and says, "Hey, we need to evacuate this building. It's not safe right now. We have a gas leak next door." Those are considered authorities that they are able to have. And much of what they do and can do is in our International Fire Code book. So keep that in mind. These are locals, and we will reference those again here a little bit further down. But those are some of the authorities that you will likely encounter, and some of you probably already have. Then we have our state. Washington state authorities would include agencies like DCYF, Department of Health, Labor and Industries, and then our office, obviously. With our state and authorities, they do have very different roles, and we're going to go over that here shortly. But just to get you guys on the basis of childcare inspections, local AHJs may have their own inspection programs. So some of you guys may get an inspection by your city or county. They usually have annuals sometimes, and those inspections are very similar to our fire and life safety inspections. We get this question quite a bit. Why do they have to do it twice if you're doing the same thing? Well, just to be clear, local jurisdictions and state jurisdictions have different regulations. There are some very specifics that we'll dive into here shortly. And we can definitely address any questions you guys have on those specifics if you've encountered some of those. You may have several AHJs, and no childcare is the same, which means if you have a childcare facility and you have one almost identical across the street from you, but they are in county and you're in city, you guys may be able to have more allowances than the one across the street, or vice versa. So that means a lot of the times when you look at childcare compared to another childcare, they are so unique, and it's really up to a lot of different factors that can allow childcares to do certain things and other ones not. So we do get the comments quite a bit when we go out to do our inspections where people say, "How come they get to do that?" Well, I promise you there's usually codes, ordinances, or regulations that may give those exemptions. Okay. All right, we're going to talk a little bit about compliance. Whenever you're talking about facilities and you're looking for a childcare place to either start service in that area, or you are wanting to know if you can make a change in your facility, everything that drives those permits, those plan reviews, those inspections is all about compliance. So our ICC codes, this is just a couple examples of a few of them, tell us when something is required. So that could be, this building's so big and we want to have this many people in it, we're going to need a fire alarm system. So that tells us when and where those things are going to be required. So this is kind of what we base some of our plan reviews on. Then we have what we call standards, the NFPA, which is the National Fire Protection Association, tells us how to come into compliance. Now, I used to call these books the Blandards because they are a lot of calculations, they are a lot of numbers, and math was not my favorite subject. But there's also a lot of information on your ITM in these standards. So we reference these all the time. They are literally scattered throughout all of our ICC books. But each of these two things combined will drive kind of what your requirements are for childcare plan reviews and permits. So we have terms in the code books where if you're looking at doing any type of business for childcare or commercial, or I would like to run a business out of my home, they're really separated into two sections. There's either construction permits or there's operational permits. And when you're looking at facilities to potentially start a childcare in, both of these may apply. It just kind of depends on what your building is, or if you're building brand new. There's so many options out there. And I know, kind of looking over your notes from earlier, a lot of you are kind of looking for more facilities, and a lot of you guys are trying to open up new childcares. There's a lot of research that should go into these topics because it will impact what your allowances are with the childcare. And just to kind of clarify where these start, if you are looking at doing construction, at the State Fire Marshal's Office, we will generally refer you to your local AHJ just to start because we're not familiar with some of their ordinances or regulations that they have. They may be on a different code cycle. There's a lot of things that could be applicable. So we start you with City Hall or county and have some discussions if you have potential buildings in mind. Or if you're looking at building. There are zoning ordinances. There's only certain places you can put a childcare, right? And I know some of you guys already know all this, but we want to make sure and cover it that any type of construction permits should kind of start there. Operational permits, we generally send you to DCYF. Operational permits really mean only one thing. I would like to operate this type of use in this building, which means it could be a store, so a mercantile, or it could be a shop for car services. But operational permits generally are for a building that's already been built and you want to lease it, take it over, and start doing the childcare. Now, with that caveat, I usually recommend that you start with both. DCYF is probably like, wait a minute, tell them to come to us first. I really feel that you have good resources available with your locals as well as DCYF. And if you're inquiring about starting a child care service anywhere, both are good starts. It's really important that you research that before any signatures are made because your limitations on what you can do in those properties are really based on these two agencies. We usually don't get involved until a little bit later in the process, and we'll kind of dive into that as well. All right, we're going to take a tiny little sidebar here and talk about compliance, specifically with ITM. When we do get involved for your inspection processes, and when you're looking at these buildings that you potentially may use or you have currently, fire life safety systems are really important. So again, just as a reminder, these systems are considered your fire alarm, your fire sprinkler system. You may even have what's called a UL 300 system, which is a type 1 hood system, and you cook under that hood system. You may have a plethora of other types of systems. But when we talk about ITM specifically, we want to make sure that these systems are maintained. The code says shall. And this is really imperative that you guys understand that anytime you have any service done either by a technician, it could be services that you do on certain things. We want to make sure that you are keeping all of your documentation either in a binder or somewhere that is accessible. I do know that DCYF has a form that you guys keep your drill records on, and sometimes your ITM is on there. It could be the monthly checks on your carbon monoxide detectors. It could be your monthly checks on your fire extinguishers or exit lights. Several things that we call ITM for fire and life systems can be conducted either by a technician or it could be done by you. So we look for those things on site. So it's really important that you have that documentation available. A really key part of fire and life safety systems, and you may have heard this once or twice from your local jurisdictions, if you have been through any plan review whatsoever. These systems have to be working for anyone to even enter the building. So when we're talking about a certificate of occupancy, I'm not sure if anyone knows what that is or is familiar with that term, but once your building is approved for entry, all of these life safety systems have to be in compliance. So we at the State Fire Marshal's Office can't accept I have somebody coming, they'll be here in a week. Can you open us up now? We get that quite a bit. And unfortunately, due to the state laws and the code requirements, we are not able to proceed with your application or approve your inspection until we have the work done. And that includes being able to look at some of these reports. We will research and say, does your technician have the right certification? We have some very strict requirements for who is allowed to work on some of those life safety systems. And we want to make sure that if you hire somebody, that they are qualified. I have only been to a handful where we have had a child care hire somebody and they were not certified. And we had to report them to our other division in the state. What that means for you as providers is you would have to hire somebody else that is, and you may end up paying twice for a service. So I always tell all of my child cares and any of the providers we go to visit, if you want to know, is this company okay? Feel free to reach out to our office. We will let you know. We have a significant amount of resources to research that for you, and you don't have to necessarily do that on your own. But nonetheless, you can always ask a technician or a company, are you certified to work in the state of Washington? And that goes for plan reviews as well. So if you are hiring a contractor or somebody to come through, we have requirements that they are certified and licensed to do the work in Washington state. So I hope that kind of gets some clarification on some compliance. Okay, I hope we're doing well. Chat's doing okay. I see a couple chats coming in. Try and take a little bit of a brief review on some of these.
Yeah, no questions at this time.
Great, thank you. Okay, let's talk a little bit about rules. This is where we're going to dive in a little bit about local jurisdictions and state, and then as well as facilities versus homes. So a childcare facility is really any building that has care for children within 24 hours. We inspect these facilities when we are requested to do so, to be licensed by DCYF. So we will never, as deputy state fire marshals, just waltz into your facility and be like, I'd like to do an inspection today. We do these by request only, and there's several different kinds that we can come in and do, depending on what DCYF requests us to do. A family home childcare is also licensed by Washington State, but it's really for 12 children or under, in a home. And those are two very different situations. The best way that I can describe what these are like is one is kind of a commercial building and the other one is a residential. That's really the terms that we use in the code world. Commercial buildings are designed to be open to the public, so they have a lot more regulation. And residentials will still have regulation, but it's a little bit different because you are operating out of your home. So there's some limitations and there's some allowances. And just so you guys know, we at the state do not inspect residential childcares. That is normally done by the local jurisdictions. And occasionally, if a jurisdiction is really small and they don't have the resources or the funding to be able to have a program that does that, we occasionally can be called in to do so, but it's only by request. And I think in the 2.5 years I've been at the state, I haven't done one, not for family ones. I used to do them at my prior job when I worked for a local, but not at this position. So childcare facilities, there's a very important number here. You guys see that 2.5 years. When we're talking about an inspection for a childcare facility, DCYF has a lot of very specific identifiers for ages. So we have infants, right? We have preschoolers, we have toddlers. They have their own regulations on how those operations will affect those children in care. Well, for the fire code and everyone in the fire code industry, our special magic number is 2.5 years old. It is the opinion of the State Building Code Council and the ICC that 2.5 years or younger requires special assistance and a lot more precious care, if you will, in the event of an emergency. And the commercial type facilities or these childcare facilities can be classified as an E or an I-4. Those are the two that are allowed within Washington State. Now, I highly recommend, for those of you that are not familiar with these two designated occupancy types, and again, just to clarify, the only thing that occupancy type means is the use of the building. That's how we label them. Do some research before you apply. Specifically, if you have buildings that you're looking at in existence, there are certain benefits to having an E occupancy, and there's certain benefits to having an I-4. It really depends on a lot of the factors of what you as a child care provider want to accomplish with your care. So because there is a lot of complexities in occupancy type, your locals as well as our office can assist you in kind of understanding and navigating those. We generally love to have a consultation requested by DCYF with you before you sign the lease, before you purchase the property, because we want to make sure and assist you in understanding your limitations if they're applicable. So with that, keep in mind these occupancy types. They are very specific on the size of your building, the age of your building, how many exits you have. All of these things are very imperative on what you can do within that building for childcare. So we'll dive into a few of those, and I know this one's going to have questions later because we get them quite a bit. Family home childcares are considered R3 occupancies in the state. And again, those are usually inspected by your locals. Every once in a while, we will get, I've heard at least, we get requests for those. But if you have questions regarding residential care and licenses, your local jurisdiction is one you'll want to talk to first about that. Regarding one of the biggest questions that we see on the inspection side of things, a local AHJ cannot conduct fire and life safety inspections for childcare facilities for licensing purposes. That is a designation for our office to do. We have WACs that state it is our job to come in and do that. A lot of the times we get this question, why can't my local fire guy come in? He's great. He's been here before. He knows all my kids. There's a lot of reasons why those designations are there. Primarily, a lot of the codes and WACs that we study on a daily basis at the state side, the locals don't necessarily utilize a lot or have to utilize. We do work with local AHJs quite a bit, but because we are statewide, they may have a 14-mile area that they cover. Well, we cover the entire state. So there's a lot of different factors that kind of come into effect with those inspections. So we do try and do a little research about what those requirements are with the local side of things. But for the most part, we observe and report, and everything goes back to DCYF for licensing side of things, because they are your ultimate approval authority. The local AHJs may do fire and life safety inspections for a facility or a home, and it could be done periodically, like I kind of stated earlier. It just depends on if they have a local requirement for it. So they have what they call fire and life safety programs. Sometimes they're run out of your fire department and you'll have firefighters come by. Sometimes you will have a building official or a fire code inspector. It really depends on the locals if they decide to do so on that. But again, going back to kind of our connections, if you have residential childcare questions, start with your local AHJ and with DCYF, obviously, on any type of changes or new applications. That's really goes through a land use side of things first, which we don't do anything with. It goes through the local permits and plan review processes through there. So unfortunately, we don't have a lot at the state level that we can assist on that. But when it comes to your facilities, commercial buildings, start with DCYF first. We are always available for questions. One thing I will always be really grateful for is we have an excellent relationship with DCYF. If they receive questions about building codes or fire codes, they usually will reach out to the Deputy State Fire Marshal for your area and pass that along. So they're an excellent resource to get to us. So if you have questions on those kind of things, definitely worth looking into. Okay.
So, Andrea, are you familiar? Somebody asked about, Ava asked about Senate Bill 5509, which I think is just about zoning. And she's wondering if that's, let's see, if this will cover code for 5509. So do you know if there's any impact there?
So when it comes to legislation right now, that's a very complex topic because it's at this time, at least from what I have heard, and again, I'm not directly affiliated with a lot of the discussion going on at the legislation level, but there is discussion about fire area specifically. They are trying to make things easier for you as childcare facilities and applicants to be approved. So generally speaking, we look at so many factors with your building on an inspection, including when the building was built. So if you had a building that was built in 2002 and you were approved at that time to occupy that building and start your business for childcare, we couldn't come in and say, hey, we got new codes. You got to come up to compliance. We're going to make you tear out this wall, put in new lighting. That's not how the codes necessarily work. So with this specific legislation in question, they're discussing if you are leasing a space, that we are focusing more on just the lease space and not necessarily the entire building. However, we have been told at the what I call boots on the ground level, which is what I am, to delicately tread right now until we have more official information on how to proceed with those. Again, it's very complex. I will say that legislation information will eventually be shared with DCYF regarding our processes very soon. But they are literally right in the middle of discussions of that right now. So until then, we are operating as normal, if that makes sense. Does that kind of answer your question? I know it's kind of vague. It's probably not not the answer
Well,
you're.
I think it's fair when there's new legislation that
Mm.
agencies need time to figure out how that will impact. And
Yes, it's very, I do know that the direction they are trying to go is to make it a little bit easier on you as providers. I think they are at that level really understanding the need that we have across the state for approvals and the delays that we have experienced, which we're getting into next. Um, yeah, so there's more to come on that. And as I said, as I find out more and as our office kind of is able to delineate something a little bit better for you, we will stay course as planned. Okay, so let's talk a little bit about timelines. We are required to inspect facilities once requested within 30 days. So when we receive the email, we have an inspection request for this facility. As deputy state fire marshals, we have 30 days to complete that initial inspection. Many of us are being pulled all over the state. We have a total of 12 inspectors that are inspecting across the state of Washington. Just to give you a little idea about our busy schedule, we are subjected to drive time. So I have an inspection that's 4 hours from where I'm located. So for me to schedule, it takes a big chunk of my day. But nonetheless, we will attempt to get out to you as soon as possible. Don't ever be afraid to reach out to your licensor and say, hey, it's been a few days. Can you tell the fire marshal I'm ready? We will definitely do our best to get to you as soon as possible. And after we complete your initial or a post-inspection, if you're approved, we will send a report to you, and we like to CC your licensor so they're aware within 24 to 72 hours. We have this kind of caveat of 72 hours because we work sometimes 410s. So we may do your inspection on a Thursday and you might get it on Monday. Or we may have some research we're trying to do for your facility. That could be, we need to get a more clearer understanding of the certificate of occupancy from your local jurisdiction. We need to make sure and see there was a permit for this, or acceptance testing for a new installation of a system. So there's a couple of things that we try and do though in regards to getting you moving forward, but we like to get those done as soon as possible. And just a little side note, we do require signatures on all of our reports. Some of you, I believe, may have access to scanners and maybe copier machines. A lot of childcare facilities we know, I've noticed, do not. And so they use their phone. We usually tell people the longer it takes for us to get that signature, the harder it is for us to get to Olympia. So our office, what we'll do is send your report over with the signature, and then our office sends it to DCYF, and there's quite a bit of a process. So because it has so many hands involved, we usually say, get that in as soon as you can. That will help your process go a little bit faster. We do have a non-compliance notice that I have yet to use. It's just in the event that we don't have someone signing or not answering their email. And we usually have to notify DCYF saying, hey, we are not getting a reply. Sometimes it's a bad email address or a miscommunication, but nonetheless, that's available. And we try not to use that if we don't have to. Okay, let's talk about timelines for disapprovals. Just like before, we'll receive your application and we'll do your inspection within 30 days. And if your first one does not pass, you will get 30 days to correct all your citations. This is not a hard 30 days. We will not come back right at 30 days. That might fall on a weekend, and we don't like to work weekends. I don't know anyone who does. But you can also reach out to us and say, we're ready, and it's only been 5 days, and we will do our best to schedule you then. If your second inspection, which is a post-inspection, is what we call that, is disapproved, we have to get a approval from your licensor to come back out. And usually that's just an email. But just keep that in mind as we're in the middle of your process. If you're like, you need to come back out. It's like, we got to talk to your licensor first. After 3 inspections, it gets a little bit more, where are we missing the mark? Maybe we need some more education or some more assistance. It looks like we have a couple chats here. Is there any questions so far on this?
Nope, we're still good.
Okay, great. Good. You guys are just talking about me. I can't read it right now because I got my screen up. So, okay. So some challenges that I have witnessed with these timelines, and this is for hopefully some of the better advice I think you're going to get out of this whole presentation. Ask about consultations. Those are really important, especially on potential properties you are interested in, because there are so many codes that can be involved in that. I have seen countless times a child care facility. I've gone to the site and I walk in and they say, oh yeah, we got this building for a really great price. We're locked in for 2 years. And I give them all their corrections, which is a lot of construction related items. It may be electrical. It could be exit lights. There's a lot of things that they may have to do as a facility. And they're not the owner. So what that means is it's really difficult for them to go back to their landlord and say, hey, I need you to install exit lighting. If it's not in your rental contract, some of those responsibilities, if you will, it can be quite challenging to you as providers. Are you paying for it or are they paying for it? Is it a requirement for them to do, or do you just have to do it because you're a child care? So we always tell people that consultations are an excellent way to kind of get a little bit more information. When we look at a building like a church that has an excellent space for childcare, those are churches that maybe have boards that meet once a month. And being that you have a 30-day correction notice, they are going to approve your funding much, much later. It takes time and it pushes your scheduling back. The other thing you want you guys to be aware of is you are at the mercy of a contractor sometimes. So their schedule is generally 2 to 3 weeks out on average. So if you have a system that needs to have an inspection or service, you have to wait until they're able to be there. We'll go over some specifics of ITM here at the end, but those should take priority when you're getting your inspection process done.
So Andrea, can I just interrupt for a minute? A couple of things that have come up in the chat. First, the most recent question, what is the difference between an initial inspection and a post
Mhm.
inspection. And then also when we were talking about the SB, oh my gosh, SB something or other. Um,
5509.
5509, thanks. It apparently was approved a long time ago, and then I did click on the legislation. It said it was signed July of 2025. So I'm wondering if you um have information about how that will affect um resident family child care providers who want to get their facilities zoned differently for a center, or who might have that information.
That's definitely going to be the local. Well, I should start with the local, I would say. Some of those regulations, because they're fairly, I know they've been approved, but they're fairly new. We're more at the stage of it's not necessarily clear on some of those fire areas, some of those zoning ordinances that are going to kind of impact the facilities. But right now, the local jurisdiction is where you would have to start with that because that's a land use type question. So anytime you're talking about a change of use or a land zoning change of use, those are local questions for sure. Our office is really trying to navigate how we proceed because some of the verbiage is not necessarily aligning with the fire codes. So that's why we have yet to really clearly define and concisely define that for you guys at this time. At least that's what I've been told. We have a lot of research I think they're doing on that. So yeah, unfortunately, I don't have a lot of updates on that, but I will look into it and see if I can get some information
Yeah, I
back to
think
you
that would be
later.
great because it is completely frustrating for a childcare provider to hear that it's going to be left up to a local agency at all, because then it becomes an interpretation issue where
Yes.
somebody in one region might get a different answer than somebody else in the same situation,
Mhm.
just in a different region of the state. So
You're
yeah,
absolutely
some
correct.
follow-up would be great. Um,
Yeah, and I'll
and
look
then
into that for sure.
okay, and then the difference between an the initial, I think it says
And post.
entail,
It means initial.
initial
Oh,
inspection and a post inspection, and then we do have another question after that.
yeah, so the initial inspection is basically your very first one, and then we call them post inspections. Sometimes they call them re-inspections, but it's basically your second one. But we call them post because you may have a third or a fourth. So yeah, we have 30-day increments in between those for allowances for citations to be corrected.
And those would not take place if on the initial one everything was good.
Absolutely. If you have an
Okay.
approval, you only have one.
Yeah.
Good questions.
Okay, and then Dee asked, she says, I lease in a church. A replacement of fluorescent lights with LED is planned for June with application to Department of Ecology. Would a fire marshal inspection be required?
So that's a great question. It kind of depends. The lights that you have in your building for emergency egress are considered a life safety issue, but it's not a system necessarily. So it depends on if they are egress lights. It depends on if they're in the classroom. Generally speaking, though, when we go out to do an inspection and if an inspector sees a violation like that, it has to be approved before we can proceed with your approval to DCYF. So in essence, yes, that would be a part of your life safety. Um, Egress and what I like to call early notification is kind of the term we use in the code. Those are your two biggest priorities when it comes to building safety. You need to know if there's an emergency, and sometimes that's a smoke alarm, sometimes it's a fire alarm, and then you need to know how to get out as quickly as possible. So those egress and early notification, those are a part of the life safety components, if you will. So
So lighting is it would require a fire inspection?
emergency lighting. So we have what's
Emergency
called,
lighting.
yeah, I kind of,
Okay.
and we actually have some pictures of those. I'll show you kind of our what we call bug eye lights or
Yeah, think about the lights on your exit signs. That's what
Yeah.
yes.
it's talking about. So your pathway of exit from your building.
Yes, correctly.
Right.
Right.
Not the lights in your not the lights like in your classroom.
Yeah, from
Yeah.
the comment, I was taking it to mean just regular fluorescent lights in the classroom. So, okay.
Correct. Yep.
All right. So we have another question from Susie Hanson. Do licensors know about these issues and inconsistencies with fire marshals and the rules so that it is not a child care program's problem?
This is the thing about inspections and inspectors. In all the 20 years I've been doing this, you could take 5 inspectors and put them in one building, and you will likely come out with similar reports, but not identical. And that means every inspector may see something that another inspector doesn't. The very difficult part about that is if you were to look at our codes and standards books alone, a really thorough and well done inspection, you could have lots and lots of citations. But we can never really, as inspectors, speak on behalf of another inspector. Some inspectors come from backgrounds of servicing of the systems that you have. So they may see things that not necessarily another inspector would see. What we do, though, like to do is with these consultations, kind of give you some heads up on some of those things you may be facing. But if you start to see some discrepancies of, let's say one child care didn't get written up for something and you did, we usually like to we like to explain that sometimes it does depend on the building. It could be something as very small as there was a gate that was 52 feet away from your building and your gate was 48 feet. Well, there's codes that say within 50 feet of your exit has to have an unlocking egress that is single action. But the other facility doesn't have to have that because it's over 50 feet. So there's some very specifics that potentially could be reasons for those indiscrepancies between inspections. And as I said before, child cares are all unique. We look at every little potential that that could affect your child care, but everyone is just so different. There's things that you may not see at other sites that we do, if that makes sense. So, but if you ever have any issues or concern about those, we do have appeal processes, or you say, I need a little bit more information on this. We're always open to hearing those things. And especially if you see, issues, I really am trying at my level to push some more education for facilities at the local level as well as the state level. We're really trying to kind of shift that more because we do see a need for it for sure. I know it's frustrating.
Yeah, I appreciate you mentioning the appeal process. I was definitely going to ask about that.
Mhm.
So Eva went on to say, because she asked about the legislation earlier, she said, currently working with local and they keep sending me back to DCYF.
Mhm.
This is new, working through it. I think the difference is I'll only be licensed for mainly 20 to 22 compared to a center that might be much larger. And she says she's being patient and navigating through the steps. And then
Yeah.
we've got another comment that says, can you share the inspection checklist that is used for licensed centers? Is that something you can provide?
I put
Maybe,
them in there, Julie.
okay. And then Lois
So
asked, oh,
on the forms and documents page on the DCYF website, if you go to the DCYF website and go to forms and documents, both the child care center template and the family home template are available on that site.
that's great. Awesome. Thanks, Dave. Lois asked, will there be retrofit requirements or is this just for new sites?
Yeah, we don't normally do retrofit, but it does depend on the application type. And again, that is definitely one that requires a lot of research. Your facilities are really based on a couple of factors initially when we're looking at reviews. If you have an initial license, and that's actually the next slide I'm getting into here. If you're a new license, this WAC here will tell you you are going to be required to come up to current codes. So you may have a really old building and you're going in there and let's say it used to be a childcare, but it's been closed for over a year. You may have to come up to compliance with new codes. And that really dials down to one thing in your guys' world, which is it may cost some money. So that's why we tell people do your research as much as you can before you go into new facilities or looking at buildings for potential childcare.
If you're selling your business, it's better to transfer that license and not let it sit empty for a while, is what I'm getting from that.
Yes,
Okay.
absolutely. And again, this WAC, this is kind of part of some of the discussion for that SB legislation, because some of them, there's some conflicting information that makes it really hard for us to kind of move forward officially yet. But I have heard that we're supposed to have some more updated information in June, and that's what I hope to get back to you guys.
Oh, yeah, that'd be great. Then it can be included in the messaging that goes out before the July meeting.
Mhm.
Okay. All right. Let's finish. Let's get through it.
So sorry,
Sorry.
yeah. Listen, I'll try and get going here. We have a few more slides to go. Okay, so inspection expectations. We will likely be on your site for about 1 to 2 hours, given the size of the building obviously makes a difference as well. And your spaces need to be ready for care, which means they have to be set up. We do have a few places that are like, oh, we were going to put the furniture in later. Just make sure you're ready when we do come out, because we do quite a few things there. This is another big one. We can only inspect what is on the request per DCYF. So there's no such thing as on-site approvals. So you can't say, well, now that I know it's going to be hard to do toddlers in this room, I think I'm going to change it to school age. We can take our observations and report back, but we're not allowed to approve anything until we have official word from DCYF. We do inspect the exterior and interior spaces, as well as licensed and non-licensed areas. A lot of the times childcares go, why are you inspecting this? It's not a part of my license. When we look at a building, there's a lot of different factors that are non-licensed areas that may impact you and your children. So we definitely like to see the common areas, if you will, so passive egress. You may have half a building that's not in use, but there's an exit at the end of the hall. We usually like to walk that hallway and make sure that there's, no clear of obstructions and whatnot. We also will take measurements of all the applicable areas, and those are usually classrooms, licensed areas, and sometimes staff rooms. We like to kind of paint a picture, if you will, for the licensors so they have the information they need as far as areas that we looked at. When we are doing measurements, this is kind of a big one we get asked all the time. We will come out with our little measuring tool, and we look for sizes of these spaces, not for licensing capacity. So we're not there to say, oh, you can only have 4 kids here or 10 kids here. We are measuring to see if your building may have other requirements from code. That could be like a fire sprinkler system or alarm system. And it's really kind of just to match and make sure we're on the same page as what's on your documentation that you submit, like certificate of occupancies. But we do not do anything with licensing capacity. That is all up to DCYF. All right, so we're going to talk a little bit about your systems. I'm going to go through a little bit quickly on these because I know you guys are going to get copies. But in regards to a fire and life safety system, we have annual maintenance, we have quarterly inspections, we have 5-year inspections, and sprinkler head inspection testing, which can be varied. So if you have a sprinkler system, this is one of those systems I would recommend that if you don't have it getting serviced and you have an existing facility, make sure you're on par with that, because any application that comes through, we will be looking for all this documentation. Again, these are life safety systems, so they are the thing that might hold you up from getting your approval. And it all depends on the type of system you have, but these are our kind of our generals that we look for, and I believe it's on that form as well that we had that was just referenced. Regarding our fire alarm systems, inspection, testing, and maintenance, those have an annual and a semi-annual. Depending on your system, though, there are some really, really old ones. This system right here in the picture is an addressable system. Zoned systems are basically ones that have little tiny lights on them, little indicators, and they don't have any verbiage. So that's kind of how you know if you have a really old system or not. But sensitivity testing is one of the things we do on those systems as well. And it depends on if you keep a nuisance log. If you have questions on that, I'll be happy to answer those, but these get into a little bit of technical stuff. If you have a hood suppression system, that's what this is in this picture here. That's for your cooking operations. Those require semi-annual service and annual cleaning. And you guys will know here that there's a theme going on with these. It's like the past 12 months, the past 12 months. We generally like to look at your ITM for the past 12 months. And so it's, again, good to keep all these records on site. But when it comes to inspection reports and whatnot, that's what we'll be looking for. And those binders are really, really helpful if you have somewhere to keep them. Some of these might not even apply to you. So if your building has fire and smoke dampers, they are required to have an inspection after 1 year of installation and then every 4 years after. We actually don't have anything to do with the qualifications on that. That's actually your local who does, which a lot of the time they don't say much. But you may not have any dampers at all or smoke dampers. If you are in that situation, make sure and get that in writing so you have that for any inspector that comes through. That could be done by your HVAC person. That could be done by your facilities maintenance person. Says we do not have these here. So it's really helpful to have some of that information if you are asked on site. And then we talk about fire doors. If you guys are going into some larger facilities, you have to do an annual inspection on these. There's no certification that's needed, and we have a list which has 13 points on it. And it's basically these doors that you see here in the right corner, they will have a label on the inside. That's how you know if you have fire doors or if you have it on your plans. Doors are really important in your emergency planning. This is a picture of a bedroom that was at a Underwriter Laboratories test site. And this is the bedroom when it was closed with the door after a fire had run through that area. They have a program called Close Before You Doze. So if you guys ever are in that unfortunate, horrible situation of a fire within your facility, teach your staff when they're doing their drills to close those doors behind them. They save a lot of time and cleanup for sure. Okay, let's chat a little bit about your fire evacuation plan. So these have to include your entire building and each floor that you are occupying. So we tell people one of the more difficult things for inspectors is looking over your plans, and sometimes they are missing some of this information. So you got to show your 2 exit evacuation routes and any gates and exterior areas. So if you have ramps, if you have play areas outside, we definitely inspect those areas, but it's really good for your occupants of the building, especially ones that are visitors, like on parent-teacher night, to know what your building looks like if they have to evacuate quickly. It has to have a meeting place on there, so you'd want to be able to make sure avoid areas that maybe a fire truck would come in, and they have to be posted at your exit doors in your classrooms. We do want to see the unlicensed and unoccupied areas, as well as fire extinguishers. Notice I put include here. These are not requirements, but they're usually good for us to observe just to keep on the same page. I'll give you an example here of one that I had to change the name for, but I do have permissions to use. But this is kind of an idea of what a floor plan would look like. You have your meeting place, locations of various things. This one actually put emergency folders and first aid kits. You're welcome to do that, but these are kind of what we like to see them look like, if you will. Okay, and then this is where we talk about your exit and emergency battery power lighting. So these are the ones that you need to test once a month, and then every year there's an annual 90-minute power test. And that's only on these bug-eye lights or battery backup lights. Keep in mind, if you have 2 exits from your classroom, we do have code that says you might need to have 2 of these lights. These are the ones that are kind of most common that you see. We have some other illuminated exit signs, but these are our battery backup ones that if they have a battery, they will need to be tested. So the ones on the left here, these are radioactive, and these ones are actually just illuminated. But keep in mind, we will let you know if those do have a requirement. Every once in a while, you'll see some lights like these. These luminaires are sometimes come with buttons on them, and they also have a backup battery. It just depends on what you guys have installed. Okay, I'll do a quick pause here. Does anyone have any questions so far on any of those? Okay.
I know that we are behind at the moment, so I'm hoping that we're almost done. But
Okay, yeah.
I do want to mention Jamie had a question. She
Mhm.
said, "Can you talk about the process of adding a classroom slash expanding? Is the same procedure on your end as it would? Oh, is it the same procedure as if you were opening a new center?"
Yes, that would be considered an initial application, I believe, or sorry. Well, I won't clarify on what DCYF would classify that as. It depends. If you're adding square footage, that's likely going to have to go through a building permit process. But if you are putting a wall between, that might also be a building permit process.
Yeah, I
But
think, yeah.
am I understanding that question correctly?
Yeah, I think generally, and maybe somebody from DCUAF can jump in quick, but basically, people are asking if there's a change of environment, adding a room to an already existing license, does the fire marshal come out in the same process as a new license application?
Correct. Yeah.
Is there someone on that might be able to answer that?
Yes, Dave, I can answer it. Yes. And the
Thanks,
answer
Travis.
is yes. That
Okay.
yeah, yeah.
Yeah.
Licensor goes out to it's not a new application, right? It because you're talking about adding a classroom.
Yes.
But definitely it's a new classroom, so fire needs to go out and then we do our whole bit too, but it's not
Okay.
a new application.
Mhm.
And same process that the licensor requests the fire marshal to come out.
Yep,
Okay, perfect. Thanks,
yep,
Travis. That was
yep.
helpful.
No problem.
Yep.
Thank you. Okay, so moving on, we do have our smoke alarms and CO detectors, which also have monthly application or activation testing. We recommend that you put your dates on them because they can expire. Fire extinguishers as well require monthly. We look for the last 12 months. And again, a lot of this stuff we can find on your form. You do need to hire someone to service the extinguishers annually, and they cannot be mounted over 5 feet in height from the top of the handle. That's for ADA requirements. There's a minimum size there. And again, I'll let you guys kind of take this information back with you. If you do have one of those hood systems, you have to have it a specific type, looks like that silver one, in your kitchen cooking areas. Okay, and we'll go over briefly on fire drills. You guys have 12 required a year for childcare. You want to start making sure that you're not holding them at the same time every time. So try and give about 2 hours minimum. And if you have a fire alarm system, you have to activate it. That means you contact your monitoring company to do so. Let them know you want to do a test. Those are just good practices, especially for the kids to help them maybe hear the loud sound and they can cover their ears. Or if you guys have a mock drill that you do, it's just good sometimes to do that. And we will look for the past 12 months as well for review. And then make sure just make some notations, what didn't work and what didn't, and adjust as needed. Fire drills are just really good practice. And these are some of our common code violations that we see. If you have a sprinkler system, you need to have clearance from storage. That means if you have shelving, you can't put it usually all the way up to the top. We got to make sure that sprinkler head is able to do what it's supposed to do. This is a picture of a loaded one. So if they are really dusty, make sure your contractors are cleaning those when they come through and do their ITM. And then electrical. Extension cords are really only for temporary use. Power strips must be listed and have surge protection. And then we don't like to see daisy chaining. And then make sure your appliances like refrigerators are not into a power strip. That's one we see quite frequently because Generally speaking, those will be in your manufacturer's requirements, not allowed to go direct into, or they have to go directly into a wall. So we look for electrical when we're there too. This is a picture of a corridor from one of the childcare schools that we were at from a colleague of mine. It's Christmas time. You guys get 20% of your corridors can be covered at any given time, which is really hard for holidays. But these corridors have to be clear of what we call fuel. Unfortunately, you guys call it artwork, which is always amazing and awesome. But this gentleman went out there and did an inspection, and he had seen all of these beautiful decorations. You guys are amazing crafters. I will give you guys that. But storage for clothing and cubbies and decorations, got to keep them clear. There's 5 feet that's should be clear because these are how we get out. And it's usually where people are combining to get out. So make sure that those are clear. Because what we do in the fire and life safety thing is we come back 30 days later and we get this picture on the wall. Everything was taken down. We're not always the most popular coming in when we have to tell people like, oh, take down all the celebration stuff. But I promise you, we all get to go home and celebrate the holidays if we are all on the same page. And that's really what it's about. But we kind of got to giggle about that one. Okay, last up here, just really be aware of your guys' areas. So fire alarm control panels, equipment rooms, all of these are places that need to be accessed, usually by your technicians, and especially in the event of an emergency. So make sure your fire lanes, and parents like to park in those sometimes temporarily. Try and keep mind of that as you guys are, doing everything you do in your amazing childcare provision. Other than that, I think that's all I have for you guys. Sorry, I went a little bit over. We had a lot of questions today, but this is our email here. I would recommend starting with that because many of you are all over the state. If you have questions, they'll get it directly to your deputy within your area that can hopefully help. But if you guys have anything else for me, I am here and available. I really appreciate you letting me share today.
Yeah, thanks for coming. It was very informative. There are a few questions. Would you mind typing your email into the chat so people can just copy it? I'm going to go up to the questions. So Jamie said, I don't have gas. Do we still need a CO2 detector? No one from DCUF seemed to know when I asked. It's an interesting one.
Great question. Yeah, CO detection is only required per the IFC if you have a fuel-fired appliance. So you may have a water heater, or you may have gas, natural gas. Those are all fuel-fired appliances. So you don't need one if you don't have any of those.
Okay. And then Lois asked, what about adding an outdoor classroom? I would think not, but wondering how that impacts internal rooms. We were talking about adding a classroom, fire marshal has to come.
Mm-hmm.
What about an outdoor classroom?
So referring to like a portable, maybe? Is that kind of the outdoor room? Or are we talking there's a lot of different terminology. I want to make sure I understand that correctly.
Yeah, Lois, do you want to unmute for a minute?
Sure. Thanks, Julie. No, I'm speaking of an outdoor classroom in a park, anything like that, because it is adding a classroom and the children may have to come in for different reasons during the day.
Mm-hmm.
So just wondering how that then impacts the facility internally.
Mm-hmm. Yeah, so if there's an addition to the license, we would get called out for that in the sense of new licensed areas that are being requested. And we would look at the facility as a whole. So there's a couple things there. If you have a fire alarm system that is in your main building and you want it to add an outdoor classroom, you may have to put a fire alarm system in that classroom. It just depends on the facility. If it's just an outdoor area, we have what we call assembly areas, but the moment that you enclose it, it would still be licensed space that we would want to look at. And again, it kind of depends on what your outdoor building looks like,
Yeah. It wouldn't be a building. I'm just speaking of an outdoor classroom, like an outdoor preschool program where the children are basically in nature all day, but they do have to come inside to be able to use the restroom and that type of thing.
Mhm.
So does that
So
then impact?
the only thing I can think of is as far as exterior areas, we will look at play structures and we will look at any type of shades. Sometimes those are included if there are assembly areas, but it depends on the size. If they're really, really big, generally we'll look at those. Some of those are exempt if they're under, I think, 100 or 200 square feet, just depends. Again, yeah, it's kind of it would do diligence for more research at least. But normally we would look at the spaces that you have indoor, but outdoors is, if you don't have walls or we don't have much to look at. Does that answer your question a bit? Okay.
Sorry,
So
I'm
you,
outside by a garbage truck. So
oh,
no,
okay.
but I'll follow up.
Yeah, go ahead and send me an email. I'd love to see some examples. Sometimes it's a little bit harder to gather all the information. With usually I'll have more questions for you. But yeah, feel free to email me. I'll look into it.
So there were a few requests for the example fire evacuation route thing that you put up, the little chart. Is that something that you can share with the community engagement team and they could put it in as a link to a PDF or something?
Absolutely. And I have a
Okay,
couple of
great.
examples, so I'll
Oh,
definitely get something together for you guys. We're working
perfect.
really hard in our office to get some more documentation for you guys. I think that's overdue, but we're just a little bit busy right now, but we're working on that. But I can send that over.
Great. Okay. Well, thank you so much for all this information and answering questions. We are going to move on to the fire safety wax with licensing. So building on the previous presentation, we have Brett Skinner, who is our child care policy manager with the licensing division, and he'll provide a brief update on the licensing related wax section connected to fire safety that are currently open for public comment and provide an overview of what is being proposed. Thanks for being here, Brett.
Yeah, thanks for having me. So just a couple of things. Yeah, I'm the childcare policy program manager, and I appreciate the comments. Lois and Susan had put in some about the systematic racism that has been involved, and so I just appreciate calling our attention so that we can continue to take that into consideration with what we do. Really important. And then also just a little bit with the bill, the 5509 that was discussed. Um, One of the things is I think sometimes we group some of those things together. So the zoning piece is getting people to be allowed to have the childcare in different areas of your county or city. So sometimes cities or counties say, no, absolutely not. We will not allow this type of childcare, right? Like we don't want a childcare center in a neighborhood because we want it to not have less traffic or X, Y, or Z with the rules that they have going on. So that bill was about reducing the city or county's ability to put up some of those walls. But some of the pieces that have to do with the fire safety and childcare licensing is that you wouldn't necessarily just be able to immediately become a center if you were in a home. You would have to make sure that your home, if you're going to be a center, that that you get a change of occupancy. And so that change of occupancy would often require some different things in terms of maybe like your sinks, the space, sprinklers. So there's some different barriers that you would need to navigate your way through. And so I just kind of wanted to throw that out as two things that often are really easy to put together. Um, in terms of what the rulemaking piece I'm going to talk about, last time that I was here, we talked a bit about a package of wax that we're going through. And in that presentation, I mentioned that there's going to be an ability, we're going to send out the WAC language, and there's going to be this negotiated rulemaking process where people can look at it, see if they feel comfortable with the language, and then you have an ability to vote on if you feel comfortable or if you feel uncomfortable, and kind of put in, type in your rationale for what makes you feel uncomfortable about it. And it's a group of wax that's been, in process and worked on. Um, so a couple of the things that we were going to do today was just mention what some of the ones that are coupled with the fire safety, so that if we had any questions, we could potentially go into them. But again, there's still going to be time for us to go through this. And then we're also just going to reiterate how you could um, go in and look when we have rules that are up for change, or how you can participate in general as you have time. I know everyone is really busy. So if you could go to the next slide. So a couple of them here. So the first one is 110-300-0470. Um, and that is the emergency preparedness. And so this one, the little X's show which WAC chapters it's impacting. So we have multiple WAC chapters. And so when we make a change, if it makes sense to make a change for our different facility types, we'll kind of go in and do that. So the first one is a pretty simple change, but it's to try to get alignment with the intent of the rule. So basically, right now, you're required to do drills. And so you have your fire drills, but we also have emergency drills like an earthquake, a lockdown, or a shelter in place. And what we kind of saw out in the field was that some providers, and those are quarterly, so some providers were just picking one and then just doing that quarterly. So they would just do an earthquake drill, and that would be their quarterly drill. And then we were not seeing that people were doing a lockdown drill or doing a shelter in place drill. And so when we go through different audits where the funding that we get, they take a look at what we're doing and how things are happening. And so they wanted us to put in the word rotating, so that providers would now each quarter do a different drill instead of just doing lockdowns. Um, and so that was the intent of it, but what we saw out in the field was that that wasn't happening. So it's a little change on that. Um, a second one is in 110-300-0166, and this is emergency preparation and exiting. And so I'm just gonna scroll up so I make sure I'm looking at the right language here. So the language says exit doors must not be partially or entirely blocked. Um, and so that's the language that it says. And I think what the intent is that exit doors and exit pathways must not be partially or entirely blocked. And again, this was to kind of get in alignment with what local building officials are already expecting. And so we just wanted to add in pathways because we were seeing some problematic things that were occurring. Um, and then a second part of that one was to add some language in um, where when there's a basement that's being used, the language right now says the portion of a home that is partly or completely below grade basement must have at least one emergency exit window or door that leads directly to the exterior of the building. And then what is being added is the other exit door, maybe through the stairway, through the interior of the home, with a self-closing door at the top or the bottom of the stairs. And again, that was to get alignment with what the building officials are looking for. Um, and to the presentation that we saw before, being able to have that door that's going to separate the fire spreading between the floors. Um, so those were the wax that were kind of touching within the fire piece. So I just kind of wanted to bring those up um, while we were having this conversation. And then if you want to go to the next slide. This is, the continuation of what I spoke to last time, that you're going to be able to provide feedback on the rules anytime that rules come out. There is an ability to do this. And then on top of this process, we're going to be doing the NRM piece. And so, all providers will be able to participate in this, and there's a communication plan that will be like coming out. Um, and then for the curious, you can go onto our website, and I'll just put it in the chat. You can see the different ways that you can engage with the rulemaking process. And you can put, how to get involved, and you can kind of click on a couple of the links to get some more information. So, it wasn't a huge presentation on anything, but we did want to touch on those whacks that were happening there. So, um,
Brett, this was great. Janelle had a question. When do these open for NRM and public comment?
so they're not open yet. It should be in the next month. We should be getting the communication. We have a rules office that we work with, and so they handle a lot of different rules from around all of the agencies with the state. And so I'm working with them to get that coordinated, um, and to get that communication out and to get things translated, so that we can make things as equitable as possible. So I would expect that in the next month and a half, so that
Perfect.
we get that. Yeah.
Excellent. Thank you. I appreciate you bringing these forward. Wondering, a couple of housekeeping items. Brett, would you and Samantha and Susie be ready to go right now for the next presentation? And then we will take the
Um,
break after you are done. Samantha's giving me a thumbs up there, so she and so is Susie.
I'm
Uh,
okay with that. Is Susie on?
yeah, they both gave a thumbs
Okay, so
up.
you're
And then Jessica, as they prepare for that, I'm wondering if you might be able to drop the Menti link uh, again into the chat for our previous presentation. Thank you. So for all that have been here before, or this might be your first time at this meeting, after each one of the presentations, we do a feedback link. And this is open throughout the whole time, so you don't need to worry about it going away. But if you have comments or additional questions about either Andrea's presentation or the comments that Brett just made, you can click on that link and put the information in there, and then that will transfer into the feedback loop that we provide then at the next meeting. So your questions and follow-ups will be eligible there. So, and then one last piece of housekeeping. After Brett and Susie and Samantha present on provider support staff qualifications, we will have a 15-minute break before we move into our afternoon sessions. So, uh, what we have next is Brett and Susie and Samantha from the state board, and Samantha's from the State Board of Community and Technical Colleges. Susie and Brett with DCYF, and they're going to provide an update on the staff qualification work group as part of HB 1648. I'll let you guys take it away.
Thank you. So hi again, and um, hopefully people have been paying attention. We've been providing updates and gathering feedback from this group around House Bill 1648. And so today we're just going to give some updates on how that's going, where the conversation is going, different things that are happening within the group. So we can go to the next slide. Um, so yeah, this is kind of just reviewing, but provide an overview of the recent work group discussions. There's a lot of work. There's a lot of time that's being spent in these discussions and finding information outside of the discussions to try to help support the work. So we're going to share the themes and considerations and highlight the work that's still to do. Um, Hopefully, we will get closer and closer to delivering closer to what the recommendations will be. So we're continuing to work through that and get input from this group as well as we go. So I think I'm going to turn it over to Sam for the next slide.
Hi, folks. It's good to see y'all. Thanks for having me here. So the work group has been focusing on a few key areas, including staff qualification pathways, how work experience can be verified, and education equivalency. So if we're thinking about PACE, if we're thinking about CDAs, how those fit into the broader system of staff qualifications. Go ahead and move to the next slide. So what we have been working on more specifically over the past couple of weeks, we've been digging into how work experience can be verified in a practical and a consistent way. So we've looked at options like provided experience letters, direct verification within the registry by directors or by employers. Part of the conversation has been identifying how to calculate experience and looking at how other states are approaching verification. So we looked at different models that other folks are using to try to make it, again, practical and consistent for everybody involved. And thinking as well about where flexibility makes sense, but we can still maintain clarity as well as accountability for folks. Can go ahead and move on to the next slide.
Hi, everyone. I'm Susie Campbell with the Early Learning Division Staff Qualifications Coordinator. And I'm going to talk a little bit about the emerging themes. So a few themes are starting to come through across the discussions. There is a clear need for verification methods that are consistent, follow a reliable protocol, and are easy to understand. There's also interest in reducing administrative burden, both for providers and staff. And overall, the group is working to strike a balance between creating more flexible pathways while ensuring those pathways are meaningful, pathways meaningfully support programs, the workforce, and positive outcomes for children and families, while still aligning with standards. In the next slide. So looking ahead, the work group will continue refining options for experience verification and further defining what types of experience should count. We're also going to spend time understanding the system and process implications of these ideas and begin shaping more concrete recommendations to bring forward in the upcoming meetings in May and June.
So I think we really want to continue to receive feedback that we're hearing. If you're hearing things, if you're having questions, or you're gathering information that you're hearing from the field, feel free to share that. out loud or in the chat. Questions you have about what's happening, um, what feels important with the work. I think that, you know, uh, to what Susie said, I think in these next two meetings, we're really, really going to get a much more concrete solutions and answers to bring back and hear. Um, we're trying to do our best not to be presumptive and make decisions without getting buy-in. There's a lot of different groups, there's a lot of different interests. And so I think it has taken a lot to get people onto the same page, to understand things, um, to do myth busting and to try to understand um, what is happening with the system, what is upcoming, a lot of those things. So um, open to feedback.
Yeah, so Brett, we have a couple questions in the chat that we can start with if that works. The first is that this is maybe more of a comment, but could be in a form of a question. I wish Merit would list other employee types like cook and substitute.
We do have that noted. I know right
Okay.
now, it's not coming up, but we do have it noted. Thank you.
Okay, thanks, Susie. And then next one, I'm going to break into two different questions. So the first is for experience verification. What do we anticipate the timeline to be in order for that to actually, for lack of a better term, show on people's merit accounts?
A lot of that will depend on how the work group makes their recommendations in what we calculate as experience, and even looking at out of state experience. So the timeline would be really difficult to give a concrete answer, but we are actively working even with Merit to update as soon as possible when we have decisions fully made.
Okay. And then the next part of this question is education verification is still taking a long time. Just one example of education being submitted in March and it's still not verified or processed. I do remember that the communication at the end of last year was that by January, things would have been unclogged and looked at having that process take quite a bit of a shorter time. I'm not sure that you guys are the ones to answer that particular question, but if there's someone, if it is you, that'd be great. But if it's not you, if there's someone else that is on the meeting today that could kind of speak for where we're at with that process. I know staffing obviously being a challenge. So,
I don't have, March seems like a long time to me, so I feel like that should probably be looked into because I believe it was taking still around 3 or 4 months, but not back in March. So I would double check for that person by reaching out to the Merit email, and I could put that in the chat. And then the other thing would be that if we include that question in the feedback, we can probably get a better timeline for everyone.
Yeah, and I would just add that definitely been a subject within the work group, and people have had some interesting ideas. One that came to my mind was almost like like sometimes when you order a pizza, they'll send you a notification that says like order received, making pizza, baking pizza, pizza delivered, something like that. And I mean, it's an amazing idea. And then what we're also working with within the work group is feasibility. Do we have money to build this? Is this something that we can build? Is it something that's going to keep working? Um, so it's really important. So I appreciate it being, raised again. And if you have solutions or things that you think work, feel free to send those in as well.
I think one possible easier solution, I like Brett the pizza deal, and that might have some dollars that would be attached to it. But I think that there could be more consistency in um, automatic reply messages, not just from education verification, but from a variety of different licensing things that just state you will expect to hear back from us within this period of time. If you don't, please reach out to X. I think a lot of times people will just send a note and then they become busy. Uh, and then it ends up, if you never hear back or you don't hear back for a long time, then it's frustrating when you go back and like, man, I did send this in February or March. So I think that if people have more of a consistent way of being able to communicate that on automatic replies, uh, there would be an opportunity for you to stick something in your calendar to say, oh, I expected to hear back from this at this point. I didn't. Let's go back to that email to say, who should I be following up with, if that makes sense. And then there wouldn't necessarily be dollars attached to it. It would just be a different way of writing the auto replies. Um, So back to another question about the looks like the director role. There has been a lot of questions among providers about the director role. If the experience waiver will allow for a director to use that and what that means for education requirements for the center. Julie, do you want to just come off mute and ask that question? I'm not sure if that's
Oh, yeah. Well, I mean, I know a director doesn't have to have education requirements. They can hire someone else to be the program supervisor that has I mean, it used to be like what, 45 credits of ECE, and then that changed with 2019. And anyway, so it's like somebody in the building always had to have that education requirement filled. But there's been a lot of discussion about the experience waiver extending to directors. And so I'm wondering, what does that mean for, can everybody in the building have an experience waiver if they've all been employed there since, I don't know, 2010 or something like that?
Susie, do you want me to answer it or do you want to answer it?
I think we're both going to say the same thing, that those are some of the questions that we're still working through within the work group and recommendations. Do you want to add anything to that, Brett?
Yeah, no, Julie, absolutely. That's being discussed in a really important way, and it is there's a lot of these little tiny questions that it leads to. If we do this, what about this? What about this role? What if somebody switches? What if somebody switches after part way through a couple of these years? So there's a lot of these little dependencies that feed into this. So we're trying to make it fair, cover liability, um, make it easier for staff, and then not make it so complicated that it's more confusing. And
Okay,
that's
well,
tricky.
I have a follow-up then. So these discussions are ongoing. Nothing's been decided completely. Once you guys come to a consensus on that and other things, will it be implemented or does it have to be decided by someone else? I mean, like the legislature, or like who's the decider here?
Well, in my mind, it's we're kind of all doing it together. We're trying to build this together. That's how I feel about it. Now we have to make sure that there aren't other things that are blocking it that we can't get around because there are rules and laws and there are things tied to subsidy and these different things. There are things that cost money to build depending on what it is that we're talking about. Um, so I think it's a collective. There's things in the work group that we are taking back to Nicole and Ruben um, to talk to them about, and then they're bringing back questions for us. So um, I think it's the group that's kind of trying to figure this out, and then there are some rules and laws that we have to factor in as well.
Are you talking CCDF rules or other rules?
Well, it could be CCF impacts. It could be like RCWs we have in place, WACs we have in place. We do have to look at the things that are connected to, but also liability, things, safety, safety and health, and what we think will be best for the kids and the families and the providers. So, it's kind of a lot.
Okay, I appreciate Ruben saying that. You guys are the final decision makers on the recommendations. It's good to know because I think back about the compensation technical work group and all the work that they did years ago, and then it just kind of, I don't know, nothing happened. So I hope that this group is able to make real change. That's all.
All right, so we have another couple of questions in the chat as we go through here. Has there been any discussion in regards to the staff qualifications for ECAP in comparison to DCYF lead teachers? If there is a plan, if the plan on 10,000 ECAP students a year, additional 10,000 ECAP students a year, that's a minimum of 1,000 staff that need to have the lead ECAP teacher requirement, currently being AAs, BAs, or college degree. Is that feasible?
I would defer to the ECAP team on discussions that have been going on around ECAP qualifications.
Susie, I don't know if anyone from that team is on with us today, but if not, we will have that as part of the questions in the feedback loop. And then I think an important point from Jamie as well, one of the most important things to consider here is that it's very difficult to find teachers. I'm concerned that some of these new education requirements without a method of pay increases will push more people out. So clear, respectful, easy to understand guidelines should be a priority. I hope that makes sense. I'm really happy you guys are looking into this or looking at this. Sorry.
Yeah, we won't be creating any new additional education requirements within this work. This isn't going to be new, more education requirements. That's not part of the work that we're doing with the House Bill 1648. We're focused on how experience can be, I can't think of the word besides celebrated. How experience should be considered and what that looks like, not additional education requirements.
Yeah, Jamie, thank you for writing this. And we one of the work group members presented a survey feedback that they had gathered from a lot of folks. And it seemed like across the board, a huge piece of that was funding and how, you know, funding and time and how do we find ways to help people with that. And that is just a really, really big challenge, and there's a lot of budget challenges right now. Um, and so I think we've got to be creative and be resourceful, but I really appreciate the comment.
All right. At this point, those are the questions that we have in the chat. Does anyone else have anything that they would like to bring forward based on the slide that's up right now? Questions, concerns, what feels most forward or what feels most important as we move forward? It feels like um, people have been able to share those things, but is there others that are out there right now that haven't had the chance to share that would like to do so? Brett and Susie and Samantha, do you have anything else that you would like to add today about kind of next steps as this work continues? Oh, hold on. Nicole said too. I want to clarify that ECAP lead teachers are not required to have a BA degree. Thank you for putting that in there, Nicole.
I just want to say thanks to Sam, one of the work group members, for coming on and helping present, and all the work group members that are in this group that continue to show up and work on this.
So Brett and Susie and Samantha as well. It's been great continuing to have you come to these meetings on this every time we have it, just to be able to keep this out in front. So thank you for doing that, and we look forward to the continuing of that as our provider supports meetings carry on. So thank you for taking the time to do that. Jessica will put again the link to the Menti in the chat. So any feedback that you have on this particular presentation, additional questions, additional concerns would be really helpful because that's all being gathered as this work continues. I'm going to go to Lois for a second. I had a question for Ruben. Any plan to return to this group with your position on HB 1648 work group recommendations before presenting them to Director Sen? I don't know if Ruben was on at the moment. Or Nicole, sorry.
Yeah, Ruben, go ahead, Ruben.
Yeah, I mean, Lois, after the recommendations, after decisions, we'll definitely kind of get back to this group and also with our other advisory groups we'll have like one final report. Nicole, anything else to add?
No, I don't think so. I guess, Lois, is the question that are we going to come back to this group to share what our recommendations are before we present them to Secretary Sen?
Yes, that's exactly my question, Nicole. Thank you. I just wanted to find out that after the work group submits their recommendations, how much room is there for compromise after that? Or is it when Ruben, you said we'll report back to this group, that sounds like this is where we're going to land and there isn't any more room for adjustments?
That is a great question, Lois.
Yeah, it is a good question. And I think, can Ruben and I take that back and look at that? I think one of the things I would like to look at just is timing and feasibility. I think that at a minimum, what seems like we'll make, at a minimum, if we put something forward that is that has a change in the recommendations or something like that. And I'm not saying that's going to happen. I'm just using that as an example, right? We would need to be clear about why that occurred. And I think, as we present recommendations to Secretary Sen, Ruben, one of the things I'm imagining is that we would be looking at what the work group recommendations were. And if there was a different recommendation we had, we would present that and why, and then would be sharing that back with this group. But I think, again, I would like to go back and look at timing of meetings and see when this next meeting is, and we can follow up on that process. Does that sound like a plan? Ruben, anything you would add to that?
No, that sounds good. We'll get back to this group for sure. Good
Yeah,
question.
thank you. Yeah, thank you. I just appreciate you considering that. And to just being frank about what sway even provider supports or ELAC will have once the recommendations come to you, so that we don't want to, well, Ruben, Nicole, I'm direct. We don't want to waste your time or ours. So just to be transparent about how much movement there is.
I think that is a fair point. And if there's something that's a really kind of hard boundary or guardrail, that we need to be really clear about that. And maybe there are places where there's considerations on how we implement, but maybe not what the recommendation is. But what I hear is in this, we can be very clear about each of those pieces so that we are being clear about what we're bringing forward to provider supports and ELAC and where there are decision points or not. So I just really appreciate you raising that.
Thank you. And there are some good questions that are coming in on the Menti that will be put into the feedback loop. So that will be continued conversations as we move forward with this work as well. Does anyone else have any additional questions right now? Otherwise, this Menti link will remain open over the course of our break. So please feel free to go into it and continue to add questions, concerns, thoughts, pieces like that. And the previous Menti will remain open as well for our fire marshal conversation. That is further up. The link for that one is further up in the chat as well. Uh, I stole one of our breaks earlier because we had that such great conversation with the fire marshal. And so we're going to take a little bit, instead of a 15-minute break here, we're going to take a 20 minute break. And this afternoon, really excited to come back for three really great conversations on child welfare payments, the early learning budget and legislative updates, and then the monitoring visit survey. And so a lot of great topics that are coming up this afternoon. So for now, please come back at 11:55. We will take a 20-minute break. Feel free to stretch, get some food, attend to your centers and your family homes that you're with right now. And we'll look forward to everyone coming back at 11:55 a.m. Thank you for a great morning session, and we're looking forward to the conversations this afternoon.
Okay, welcome back, everyone. We are ready to move on to our next topic. We welcome DCYF's Child Welfare Team. Joanna Brace is the DCYF Project Manager. Michelle Balcom is the Perinatal Behavior Health Program Manager. And Megan Tatey is the Child Welfare Early Learning Navigator. The Sewellen Project Facilitator. And if you could, let's see, Sewellen, Child Welfare Early Learning Navigator. Okay, acronym. All right, so they are joining us to seek your feedback. The Child Welfare team is working on developing a guide to improve understanding of the confusing areas of the child welfare payments for childcare, when kids are authorized for CPS. To help inform guide development, they're here to hear from you to help inform about that guide. So welcome. And I think you guys have your own slides that you're going to be running. Great.
Yeah, thank you, Julie. Yes. And Joanna's going to be running those, and I'll start us off. I'll just let Joanna get situated. Thanks for having us here today. I think that was an amazing introduction. Thank you, Julie. Just say that we're kind of a mixed bag team. I sit in Partnership Prevention and Services Division of DCYF, and we do support child welfare field. And we work a lot across many teams, including early learning and licensing division, to help support that workforce. So as Joanna gets our slides up, I'll just let you know this project is really in response to hearing from our childcare provider community, as well as parents and our fiscal folks, that these are problem areas, that there's confusion and missteps and sometimes overpayments and things that occur that are really frustrating for folks. And we are hoping that this document will help provide some transparent information about these processes and just help folks with navigating and managing these payment structures. And so we'll go ahead to the next slide, Joanna. So again, our team, in my role, I hold the policy around child welfare for childcare authorization. So the policy and procedure that helps tell all these wonderful child welfare workers what steps they must take to search for and and make referrals for childcare. And this policy, it means that childcare for children in out-of-home placement, and it means for those families who have current or recent involvement with child welfare, but their children are still residing with them. So it's kind of runs across the spectrum of situations. We'll go ahead. And again, our intended audience is any childcare provider that is currently serving children who are transitioning between child welfare payments and working connection subsidy, and those providers who might serve children who qualify in the future. You never know when a family that you're already providing childcare to might become involved with child welfare. And we're excited to kind of share this with you and try to address the challenges. So we have not developed a draft. We're still in the process of that. And we are working on this guide, but we do have a suggested structure that we want to share with you, which will include a glossary of terms and sections that describe each of these 3 funding processes. And you can see here that within each process section, we are suggesting that we, go into further detail about the components of the process. And we'll start kind of looking through an example situation on the next slide. So the process begins with a referral. With the family's consent, the DCYF caseworker creates the referral for child welfare, continuing childcare in FamLink. FamLink is that child welfare management system used by caseworkers. And the application and approval process, it requires parents applying to and being approved by Working Connections. And we have some additional resources that we intend to link in this guide as well to help everyone understand this continuing childcare service and referral that is available for families involved in child welfare system. And we will also be including throughout the guide pitfalls and helpful tips. So things we've heard that have been reported to us from providers. So again, kind of going with this example, and not all situations are the same, but in a typical example, the parent has applied within 6 months of that referral and has been approved through this continuing childcare referral, and payments are made by Working Connections. So that notification is sent out from fiscal in a social service authorization letter, and that happens once per year if it is extended. Now, our child welfare continuing childcare example is only available for a 12-month period, and once that 12-month period is ended, the family need to reapply under Working Connections eligibility, and so they're no longer eligible under this child welfare related referral. And once the subsidy payments begin, which is going to be the date the application is approved, then that's when you'd start seeing the payments. And one thing we intend to point out in our guide, and that might not be clear to a lot of childcare providers, is these different codes that you might see in your payment and billing information. Whereas, you can see here in this slide an example of a 2900 series code being specific to Working Connections eligibility payment versus a case number that kind of might show up. So we plan to go into the guide in detail to kind of help point out where you might be able to see, oh, this is a little bit of a different payment that I've seen before, and would help if there's a different payment situation going on. And again, you have no requirements around this. We just want to share this information to be transparent because we hear that it gets confusing for folks. And again, there's still the attendance requirements. If there's a child welfare continuing childcare, you'd still see your attendance automatically, appearing in the electronic attendance system. So again, no changes, just letting you know that we are all one agency, but we have these different referral types that are out there to help support families if they're involved with child welfare. Go to the next one. And so again, notification about payments ending and termination of payments. Sometimes this is where the confusion might come. So Working Connections does send out automated termination notices by US mail, as I'm sure many are familiar with, and via the SSPS system to parents and providers. Again, we hear from parents. They're not always clear on these different requirements and what their steps are that they need to take to make these transitions. So when that 12-month ends from that child welfare referral, they need to reapply through Working Connections under those eligibility requirements. And they might forget, they might not know. So again, we just want to be able to provide information that might help flag some things for you as a provider if you are working with a family who's transitioning from one payment to another.
Michelle,
Yes,
I just need to ask you to slow down your cadence a little bit for
sure. Thank you
interpretation.
for the reminder. Thank
And
you.
also, there's a question. Can you clarify, are these children in foster care or only child welfare involved families?
Yeah, that's a great question. We actually have both. So, child welfare out of home placement, so foster care or kinship care, would be directly paid through child welfare. The continuing child care referral is for those folks who are recently involved currently involved in the child welfare system. So, we may have a case open for a little while, and the children are continuing to reside with the parents, and the case closes, then they are offered this continuing childcare referral that allows them to be apply for subsidy with no income or activity eligibility requirements. It's very time limited, but it's to help them continue with any services, trainings, things that they might need to do as part of that case plan and closing that child welfare involvement.
Is there any chance of you zooming in your slide?
Joanna, would you be able to do that?
I will try. Yes. Sorry. I'm going the wrong
And as she's
direction.
doing that, I'll just say again, this is not reflective of the full procedure and all the practice, but it's just an example of the steps that could occur in a situation like this. And we really encourage childcare providers to reach out to caseworkers. And if you have clarification or questions, and if you're not able to resolve what the situation is with the parent, and we're definitely happy to help make those connections and troubleshoot any issues.
Is there a statewide phone number that providers can call?
That is such a great question. We're actually working to develop an email. It's not in the works yet, but because we want to make sure that we have appropriate monitoring and response there, because we do know Working Connections does have a very well-running system and the ability to connect to a main phone line, et cetera. We don't have the phone line capability to monitor that, but an email is something we are exploring. Again, might not be, you might have to be bumped around if that comes up, but we would have a person knowledgeable enough to make that connection to the right person for the question around childcare. Okay, and I guess the big thing we'll be stressing in the guide and that we would stress today would be that none of this is automatic. It does have that parent responsibility to complete an application process once a referral is made. There are time limitations on the continuing childcare referral, and it doesn't automatically switch to a Working Connections. There's another application process that's required. So parents sometimes are confused by those because it is all one agency under DCYF, but there are these different programs, requirements, and steps. So I don't know, it doesn't look like we were able to zoom in quite as much as we were hoping on that last slide. So I wonder if we can go
I'm going
to
to stop share and try again and see if it's
try again.
better.
Okay.
One moment, please.
And before I hand off to Megan, we just have a visual of what we kind of walked through about the high level overview of all the things, process, the pitfalls, the tips. So when Joanna gets that up and running again, we have a visual slide that kind of helps. I know as an adult learner myself, I like to hear it, see it, have it in that visual is helpful. see another question in the chat about foster children. Is it still the social worker doing the authorization, not the foster parent doing an application? That is correct, Janelle. It is still the caseworker. And the caseworker should be and might need to be working with the child care, if there's certain aspects they need to figure out, especially because we're also able to pay for family, friends, and neighbors that might sometimes be necessary to supplement hours or something like that.
Is that a little better? Is that more zoomed in for anybody?
It is, thank you.
Okay.
And I think we were looking to maybe go to the next one for a zoom in. And then we could go to the animated slide.
Okay, that's right. We got patient. Okay, and I'll probably need to zoom in again on this one. So here we go.
Again, we went through some of the steps required, and we just really wanted to kind of highlight that in a visual way, just to help folks know kind of the process that they would expect to go through. So we just suggest that, if you're not already familiar with these different codes and things, as this guide comes out, we'll have a little more information in there, like I said, that can help you flag any changes that you might not otherwise notice because you're still getting a check. But we do sometimes hear of overpayments because of dual authorizations. We might have a kiddo coming into the child welfare system that we don't know is already receiving working connections. We have some technology limitations where our systems do not share that information automatically. So we have some steps that we encourage caseworkers to follow to double check this information. There are times that we're not aware, and a new authorization for a different child care or the same child care can occur, and a child care provider may receive double payment. And then you may be contacted to work out overpayment. We want to help everyone avoid that. So we're hoping this guide will do that. So thank you again. I'm going to hand it to Megan Tatey, who's also in my team, and let her kind of finish up our presentation. And we'll continue to monitor the chat for questions.
Thanks, Michelle. Happy to be here. So on the screen here, we have our high-level process overview with the pitfalls and the tips. If anybody is not able to see, we can zoom in a little bit more, but this is more of just almost like a step-by-step of what could potentially be going on within all of these steps here. So as you can see, we have the initiation of child welfare payments. And with that, a tip would be providers must confirm their funding stream and their end dates each month. And as we cruise on over to final termination of child welfare payments, please keep in mind that DCYF may not make this termination notification. And also we have some tips and pitfalls within initiation of continuing childcare payment through working connections. So good to know is that providers must confirm their funding stream and their end dates each month. And after the caseworker submits the referral, the parent must call to apply through working connections. And we also have some pitfalls within that. So if the parent never activates the child welfare continuing child care referral, payment will not begin. And providers will not be paid for providing services that have not been authorized. And as we move over to the initiation of working connection subsidy, a tip would be providers must confirm their funding stream and their end dates each month. So just like you would with the continuing child care payment. They're very much similar in that way. And a pitfall would be if the parent never applies for the working connection subsidy, payment will not begin. Again, very similar to the continuing child care payment. And also providers will not be paid for providing services that have not been authorized. And finally, the parent applies for the working connection subsidies. That's something to keep in mind, that parent application is really important here.
And there is a question about whether or not the continuing child care authorization shows up on the regular invoice. It does, but it will look a little different in the coding. And that is something that we will be planning to include in this guide.
Thanks, Michelle. So we wanted to give folks some context about the current timeline of this project. So we are currently in our input gathering and draft creation phase. And our goal is to create the draft with provider and other people and groups' valuable input by the end of this month. And once that draft is created, we will request feedback on the draft. And our goal is to have this phase completed by next month, so mid-June. And after that draft feedback is completed, we will partner with creative services at DCYF for dissemination, as well as translation services to make sure that the tool is available in other languages. And our goal is to have this completed by the end of June. Once that is completed, we will move into an audio recording of the tool, and then finally public distribution of the tool. So we have less of a hard date on those goals, but ideally by the end of this summer. So in the spirit of our first goal on the timeline, our ask today is that we gather input from this group, and we will be doing that via a survey link. The focus of the survey will be about challenges that you face, or maybe you have faced in the past, around payment and processes with subsidies. So the survey collection will start today, May 13th, and end on May 24th. After that, Marlene will disseminate a PDF of draft of the tool, as well as a survey link where you can provide your thoughts and input about the draft. Areas for consideration for feedback will include format, content, glossary alignment, process details, and comparisons to existing materials that will identify alignment or redundancies or contradictions, as well as ideas for making the guide straightforward, so using very simple, clear language and formatting. Also with the initial launch and distribution. So for instance, where would you look to find this information? Distribution messaging, considerations for accessibility and equity, and other considerations that you think are important to mention. Draft feedback will begin in early June. The exact date is to be determined, and it will end mid-June. Joanna, you can move on to the next slide. Thank you. So we'd like to take this opportunity to ask the subcommittee if there are other individuals or groups that you recommend we should connect with for the input gathering or draft phase. And I'll double check right here to see how we could best send out this survey link for input and collaboration, if that's through Marlene or a different channel, or if we could put it in the chat. I'll just wait for a high sign for that. But yes, we'd like to gather input on anyone else that you think would be valuable to connect with on the input.
Well, I think it'd be helpful to have Childcare Aware send out the survey via all the coaches.
That's a great idea.
That's a
Thank you,
great
Julie.
idea. Yes. Okay, so
And we
we'll
have
connect.
reached out. We have reached out to Childcare Aware, but we haven't asked that specific ask. So that's wonderful.
Yeah, we'll keep that in mind. We'll connect with them and ask them to do that. Thank you.
Have there been other groups that you've already approached?
So we have a slide with our list of current stakeholders and collaborators. So we've collaborated with individuals or smaller groups across DCYF, and then as you can see, we've collaborated with DSHS and CCA. So we have our group here.
Oh, okay. So, I mean, the center organization and then the family home organization, there's a family home. I don't know what they're called. I don't know who runs the group. I know there's one affiliated with the, now I can't even think of what I'm saying, but the organization for childcare centers, that would be WCCA. Yes, SEIU. There's one affiliate. Thank you. There's one affiliated with the SEIU and there's one not. Maybe Nicole or someone else remembers how to get in touch with both of those. I don't know.
Yeah, thanks, Julie. I think Michelle and team in the internal work group, we can certainly talk about who are some of the trusted messengers that could help get that survey out.
Thank you so much.
And I saw another question, Julie, or comment about an issue of running into is finding the person who can verify childcare is approved by child welfare. Typically, if you can reach a caseworker, that's a really good place to start. And as we mentioned, we're working to have that central email that could be monitored for general child welfare, childcare related questions that could help connect to the right person.
And that's wonderful because sometimes going through, you do reach out to the caseworker and then you've got a little phone tag going on, and that's not even the person that you need to speak to that you have reached yet. So yeah, an email thing, I think that's a wonderful idea and I hope it happens.
Yes, thank you.
Oh, Jamie, sorry, your hand's up.
It's okay. I think that the biggest challenge and for us is that, and I think somebody said it on here, is there's no written like authorization that we get. And so what happens is sometimes we'll get a verbal confirmation and then there won't be, then the billing won't come in. And so then we have to be like, well, I talked to so-and-so, but so-and-so didn't put there's just a lot of, it's not as automated as the regular working connection system. So any sort of like, form or any sort of confirmation that could be sent over that said, hey, yeah, they're approved. So, because it's hard to take kids that are in the child welfare system if we don't think we're going to get paid for them.
Understandable. And we definitely want to support that ask. And that's a very reasonable need on your part, obviously. Yeah, we do know that at times a caseworker will do a screenshot with just a snippet of that child's name, the child, your child care, and that it has been submitted and authorized. Now, because of our technology limitations, sometimes it's not going to you'll hear words like batch over or like, things that you won't be like fully completed, for a certain amount of time, but that it is date stamped, that it is approved from that time. And that is something that has been done by our fiscal team and by caseworkers. So if, for that peace of mind and that confirmation, it is absolutely okay to ask about that. We are definitely looking for other system and technology fixes in a future state that can be more efficient, more automatic, where you're not depending on that manual process for an authorization, screenshot. But yeah, please know you can ask the questions. We definitely want to support the ask.
Now, this would be a huge change. I'm looking at Nicole, but has there been any internal discussion about just integrating it into the current subsidy system?
It's a great question, Julie, and it is one we have discussed several times. I think it's important for the group to know that childcare is paid for using different funds and dollars. And so some of this is about how we can maximize the amount of childcare funds that are available for all of the kids and families, but it is something we have talked about. There's a cost associated with doing that.
Thank you. Just seems like when you've got a system that already knows, and functions well, I mean, most of the time, right?
I know. Can I quote you on that?
Yeah. So, I mean, keeping the pots of money separate, but still letting the subsidy folks handle the authorizations and being that point of contact, it just seems like it would be a good idea if it was possible.
Yeah. And I think, this is one of the challenges of having multiple data systems is it seems like it's really easy to try and get everything to talk and work together. And it's just a bit more difficult than that. But yeah.
I think what has been really great as a result of this project really is it's allowed us to knock on doors and work across teams and agencies, as you saw, like through the barcode folks at DSHS. And there's been such a wonderful willingness to cooperate and collaborate, to streamline things behind the scenes, to make it easier for childcare providers and families when navigating these things. So that feels really hopeful and positive. from my perspective. So I'm happy about that while we still manage technology challenges.
So will we hear how many people filled out the survey? If you guys received any useful feedback, will you guys be able to give like a written update to this group? I hope people are filling out the
that is our
survey.
goal, to come back sometime between early June, mid-June, is we're looking at getting all the feedback and then being able to kind of close that communication loop, letting folks know what we got back.
Okay, and then we can talk about it we have a meeting in July, but certainly community engagement could send out the information in June when you have it. Yeah.
Happy
Other
to share.
questions, guys? We have a few minutes. Do we have more questions? Make sure you're clicking on that link to fill out the survey. It's a good opportunity to let them know where you've hit snags in getting authorizations for some of your CPS kids. Okay.
Thank you for having us.
Yeah, thank you.
Yeah, thank you so much for coming. That was useful, and I hope that I hope the email happens, and I hope the processes get easier for providers. So, seeing that Nicole is here, I think we're able to move on. Dave?
Yeah, do we have a mentee for this
Oh,
one?
the
I
mentee.
don't want to lose that in our pathway. And I just want to confirm that Nicole and Ruben are okay to start maybe a couple minutes early.
Absolutely.
All right. So let's have everyone on this, the last presentation. If you have any additional comments, questions, past the conversation that we just had, please input them here. And this link will stay live over the course of the rest of the meeting as well. And so you could continue to go in and put questions in that might pop into your head. So now I am excited to introduce Nicole Rose, the Assistant Secretary of Early Learning, and Ruben Reeves, Assistant Secretary of Licensing, who will be providing an update on what's on top for early learning this legislative session, including budget considerations and potential impacts on early learning programs. Nicole will also share themes from the recent Working Connections childcare webinars and upcoming changes to the cost of quality childcare and market rate survey. So Nicole and Ruben, thank you so much for joining us and having this presentation today, and I will let you take it away.
Great. Thanks, Dave and Julie. And I just want to take a moment and just thank all of the childcare providers that are here today and that show up in our meetings. And I know I saw some new names and faces, and just want to express my appreciation for all that you do in the care for our littles. It just means a lot, and I know it's a lot to take time out of your day to be here and provide input as well. So thank you for all of that. Dave talked a little bit about the things we're going to discuss today. It's here on the agenda for you. I think one of the things I will just highlight as we go through this conversation is that we don't have all the answers on some things, and I just want to be transparent about that. But what we are committed to doing is continuing to connect with you all, communicate what we can when we can, and provide some consistent updates. So just wanted to lead with that. I know folks really want us to have all of the answers. I want to acknowledge there are some significant implications as people are thinking about their business models, and we're working to work through some of these scenarios as quickly as we can. So if we want to go to the next slide. This is just a recap of some of the things. There were many things that affected childcare our early childhood education and assistance program, and working connections. So as I shared, we're actively reviewing things, thinking about timelines and impacts, and we'll continue to provide updates. One of the other things I want to note today, as we go through some scenarios, I want you to keep the word draft in mind as we talk about these things, because many provisions will require rulemaking, and those things aren't final until we get through the final rulemaking process. So just know that these are our best assumptions about some of these scenarios. Go to the next slide. So I'm going to have Ruben talk about a couple of bills on here, and then I will talk about the pre-K promise account.
Thanks, Nicole, and good afternoon, everyone. Ruben Reeves, like I said, Assistant Secretary for Licensing Division. Just real quick before I get into the two licensing bills, just want to echo Nicole and Secretary Sen about the appreciation of our childcare provider community. And like Tana said, it has been challenging for you over the year, and I just want to recognize that. At the same time, I just want to show my appreciation on behalf of the licensing division. And although we may not agree with everything, I really appreciate the partnership and that we have with our thousands and thousands of childcare providers. And just thank you for the work that you do every day, and because we could not do this without you. So as far as the two licensing bills, with 2219 and 2317, we have had a couple of the scoping meetings. We're looking at revising some of our WACs that we will send over to you for public comment, and looking for trainings, looking at our merit system as well of some potential changes regarding waiving orientation. So we're kind of smack in the middle of looking at that and how we're going to implement. And I think we've had one or two meetings so far.
Thanks, Ruben. So the pre-K promise account bill that is on here really is a bill that establishes the account where the dollars can go in order for the state to accept the Balmer grant and to expand ECAP access. And so there was some funding provided for staffing as we have to monitor funds. And then this bill also establishes the spending authority for DCYF of up to $170 million per year for ECAP. We want to go to the next slide. So last year when we talked about some of these things, I oriented us a bit to the slides beforehand, and I recognize I didn't quite do that yet this year. So as we go through this, if you see something in red on the funding level, that means it was a reduction. And this item is a reduction in professional development activities, including contracted support and training for providers by approximately 50%. It's approximately 50% of one funding stream related to this. These were dollars that go out to contractors, and so we are having conversations with them right now. Things what we are focused on as we think about these reductions is making sure we preserve access to foundational trainings that support providers in meeting the staff qualifications requirements, that we're preserving provider choice in who they are able to access training from. So these conversations are occurring right now. If we can go to the next slide, please. These next pieces come out of House Bill 2689. And this bill made a variety of policy changes that have a cost savings measure for the state. The first one is the daily attendance policy. And so this is a shift in our policy where providers will be paid based on the days that a child attends. Holidays and professional development days will count as a day that a child attends, but this is a shift in billing. And I want to acknowledge that this is a pretty significant shift from where we had been talking about when we had been talking about moving to enrollment-based pay and prospective payment. And you see the next piece on here is that funding was eliminated for prospective and enrollment-based payment, which was scheduled to go into effect in 2026. The next reduction that you see is we had some regional rate exceptions in 4 of our Working Connections childcare regions. Benton, Clark, Walla Walla, and Whitman counties will now be paid within their existing regions. I want to go back to Lois's question for a moment about the federal requirements and enrollment-based pay and compliance with the Child Care Development Fund. The ACF has just published a final rule that actually repeals the requirement to pay providers based on enrollment rather than attendance, and it repeals the requirement to pay providers prospectively. So we are not out of compliance with the feds with the implementation of this funding reduction. As far as how are we looking at savings? So when the legislature passes a bill, the department does a fiscal analysis on it. And sometimes what the legislature assumes for savings is the same as the department assumptions, and sometimes it is not. So this funding reduction is what the legislature assumed based on data that they were looking at as far as the attendance policy. In order to implement these provisions, there are some updates to IT systems. We know that change management, update to provider training, and potentially the need to do more auditing will be occurring. And so the department received some funding to implement this. Okay, so Julie, I see your questions and I'll come back to that in a moment. So let's go to the next slide. So this is about subsidy rates. So we are going to implement a rate increase for centers on July 1, 2026. That is not a change from the current law, but we wanted to note that that was happening. There are some impacts. Center rates are increasing an average of 22%. There are some rates where, some regions where rates will remain the same, and some regions where rates are decreasing. What is in 2689 is that July 1, 2027, child care subsidy base rates, whether it is a licensed family home or a center, must achieve the 75th percentile of the market. We can go to the next slide. The next pieces on here are around market rate survey participation, and we're going to talk a little bit more about the market rate survey in a moment. But what we are seeing here is that the legislature is requiring response rates in order for the legislature to use those response rates and the surveys to set the subsidy rate. So they are asking with the 2028 survey, we must receive a response rate of 40%, and each survey, the response rate needs to be greater. So we're going to talk a bit more about that in a moment. And that's important because I see some questions in here around why are rates what they are? And it's the market rate survey that helps set those rates. The other thing we see in this policy bill is it removed future eligibility expansion for families. So working connections eligibility will remain at 60% of the state median income, which I believe is about 70,000, between 70 and 77,000. I'm going to double check that for a family of 3. Okay, so let's go to the next slide. The cost of quality childcare and market rate survey is data that is directly tied to and drives rates. The legislature sets subsidy base rates according to market rate data, and variation in rates based on geography and child age are based on rate data from the survey. So low response rates can produce erratic rates for certain groups. And one of the things we want to make sure is that if and when the state transitions to a model based on cost, that we have that overhead cost data from the survey because that impacts rates. And I'm going to talk a little bit more about that in the next slide. So here is the cost of quality childcare and market rate. And I want to talk a bit about the difference between these two and why we ask the questions that we ask. As I said, the legislature uses data from these surveys to set subsidy rates. And this is actually a federal requirement that states have to set subsidy rates based on market rates or an alternative methodology. So a market rate survey asks licensed providers what rates they charge, where a cost of quality childcare is an alternative methodology where we could set rates based on what it costs a provider to provide quality care. At this time, Washington sets rates based on the market rate survey, but we do have federal permission and approval to use the alternative methodology. And we look at both the market rate and the cost of quality care to support the transition to cost of quality child care if and when the legislature decides to make that transition. Let's go to the next slide. I want to talk a bit about timeline. There are some things that we will add likely to this timeline. I would say that this timeline is a living document as we learn more things. You can see sort of where we're at right now, and that we have that change to center rates to the 85th percentile in July. And then around September, we hope to have the new subsidy billing training and guides for centers, because beginning with the October month of service, center providers will claim payment based on the new rules for that month. At the same time, we have updated state median income guidelines and new copay groupings that will go into effect in October. Then we go into the next calendar year of 2027, and you'll see where we move into the next legislative session. And then what we will be doing is getting subsidy billing and training guides out for family homes. And then in July, per the legislation, center and family home rates will go to the 75th percentile of the market. And in July, family home providers will claim payment based on new rules for the July month of service. And then January 2028, that is when the increased participation requirement is needed for the cost of quality childcare and market rate survey. So we'll be wanting to think about how we can support increased participation in that survey. The other thing I want to note about the timeline is we will be doing some additional communications or publishing of FAQs on our website. So by June, we hope to publish some FAQs and have a dedicated space on our website for that. And in July and August, we hope to do some additional webinars around these new rules. I just want to acknowledge in the chat the conversation about some of the impacts around the attendance-based policies and the questions about what are we going to do to help support the market rate study completion and getting that to the required threshold. And I'll just note we'll have more conversations about the market rate survey in the future and would love to engage this group in that. So let's go to the next slide. And I'm also wanting to do a time check to make sure we're still on track for time. And I think we are, and Dave will, and Julie will let me know if we're not.
You guys are doing great.
Great. Okay. So some of the questions that came up from the webinars that were done right at the end of legislative session, and again, during the provider webinars, were really about how will attendance-based billing work? How do we submit claims? What counts as attendance? And so I'll start with those first two questions on here because they are important. Providers will claim payment the same way that they do now. You will still receive an invoice from SSPS and you will still claim your payment through there. There'll be some new rules to follow, but the mechanism by how you submit claims will be the same. What counts as attendance? So days considered attended will include the day a child attends, allowable paid holidays, and allowed closure days for professional development. There may be some additional days within each of those tranches that a provider can claim, and we are working through those scenarios. Can providers charge families for absences? And the answer to that is no. We have a WAC that outlines what providers may charge families, and this does not include absences. And then are we still having the same complete monthly payments even if children attended one time? And the answer to that is no. The amount of care providers are eligible to claim will change. That changes October 2026 for center providers and July 2027 for family home providers. So I want to go over a couple of scenarios related to billing. And this is where I want everyone to remember that these are draft scenarios, that these are subject to change as we go through the rulemaking process. And so if we can go to the next slide. So this is a scenario where we have a toddler that's authorized for 23 full-day units. This is how we authorize care for full-time care for centers at this time. Jane attends care for a total of 10 days and does not attend care while the provider is closed for a holiday this month. However, that holiday would count as a day attended. And so this allows the provider to have 11 days considered as attended. So based on the new law, the provider may claim 15 full-day units for Jane. And that is because if a provider, if a child attends 9 to 15 days, a provider may claim payment for the full authorization up to 15 days, whichever is less. So Jane attended 9 days. We count the holiday as attended. And there, I would say there are additional days that the provider can claim, Julie. I think we're working through how we talk about those days, and I just want to be honest about that. Jason, I think you're on and want to give you an opportunity to see if there's anything you want to add to that scenario.
I am here, and in this scenario, I think you covered everything. That you covered it.
All right, so let's go to the next scenario. I just want to acknowledge again, I see all of the chat, but want to get through some of these scenarios and then we'll go back to the chat. Okay, so as we walk through this, one of the things I want to note is that in our data system, DCYF does not have the ability to pay less than what the provider claims. So whatever the provider claims, DCYF will pay out on. So Susie is a toddler who's authorized for 23 full-day units. She attends care 15 days, doesn't attend during the closed holiday this month, but that counts as a day attended. So this allows the provider to have 16 days considered as attended. And the provider may claim 23 full-day units for Susie if there are 23 days in that month. So in this scenario, the provider may claim the full authorization, and providers will want to be mindful of what are the number of days that are in that month. So if the authorization is 23, but there are only 22 days, they should be claiming 22. If the authorization is 23 and there are 23 days in that month, they can claim 23. Okay, in the next scenario, we're going to move into school age. And I think this is where we are getting a lot of questions, and probably where we are likely to see much of the variation in how providers can claim. So we have Frank, who's a school-age child, and when we authorize school-age care, Frank is authorized for 30 half-day units. And Jason, that's considered full-time care, correct?
Yes.
So now we're moving, and the bill is very explicit about using full-day units and half-day units. So you're watching us move through that process as we think about what is needed for providers to claim school age care. So Frank, authorized full-time, 30 half-day units, attends care 7 days for less than 5 hours per day, and does not attend care while a provider is closed for a holiday this month. That means that Frank has 8 days considered for attendance, allowing the provider to claim units for 11 days. So in this instance, the provider will claim 7 half-day units for the days attended, 2 half-day units for the holiday, and 3 half-day units for the allowable. And we do say absent days here. Again, we're going back and forth around the language that we use related to this. And so the provider can claim a total of 12 half-day units for the 11 days allowed to claim for Frank. Okay, I'm going to walk us through some of the eligibility pieces. So some of the frequently asked questions that we received on this are, how will family eligibility for funds be affected? How does this impact low-income families and what other supports are available? And how will families be calculated approved time for care when their schedules are unstable? So let's start with the first one. So family eligibility. So 1, state median income. There are increases in that typically in October. That is at the same time that we will look at new copay groupings, beginning with applications and reapplications for October 2026. Based on those new copay groupings, family will still have copays less than 7% of state median income. Family eligibility limits are not changing. They will stay at 60% of the state median income, and families may still be eligible for ECAP, Head Start, transition to kindergarten, and other local subsidy programs. There is no change from current practice in how we are approving and calculating the time approved for care, So we will continue to calculate the approved time based on what's an approved and allowable activity and the other rules that are around that. So there is no change here. Child authorizations are always based on child and family eligibility.
Nicole, there's a couple questions in chat that speak to this as well. I just want to highlight that our eligibility and authorizations are going to be consistent, and full-time care for a couple of scenarios in chat. Most of those children are going to be eligible for full-time care, and that's up to 10 hours a day. That accounts for schedules that change or when parents may have fluctuating schedules.
All right, so I'm going to get through a couple more slides, and then we're going to go back to the questions in chat that we can answer. And I appreciate everybody's patience as we go through a lot of information. And I, encourage folks to, as I said in the provider webinars, we really want to make sure that everyone knows how rates are set, that it's good to have conversations with your legislators and others as you are working through what this means. We certainly want to hear from you, but want to make sure that you are reaching out as well. So let's go to the next slide. Okay, so will these changes affect all provider types? So there are no changes for our license exempt family, friend, and neighbor providers. But these changes do impact all licensed and certified programs. And there's a question about, will centers and home providers be part of the implementation discussion? And the answer to that is yes. So part of that is in the webinars, when part of you all asking us questions and posting those in chat, or helping us create the scenarios and make sure that we are accounting for and implementing the law in which it was written, and making sure we're addressing some of the specific scenarios and billing that will help us create the billing and training guides. As I shared earlier, we'll be posting an FAQ, and when we do that, some of the answers to these questions will be in that FAQ. And then there will be additional training and opportunities for feedback. As I shared, we want to do something again in July and August. We'll continue to come here to provider support as well. We've had other provider groups reach out and ask how they can be engaged in conversation also. So if we can go to the next slide, just want to share a little bit about our commitment. Our commitment is transparent communication, provider support and training, and making sure we're working with our contracted partners and others on that, and getting the materials updated online, and ongoing engagement. And so when we have that website up, we'll be sure to get that out. It will be a space where folks can go to see updated information. And before I turn to all the questions, I just want to say thank you for the questions and comments that are in the chat. And, you know, please keep asking questions. It helps us make sure that we are updating the subsidy billing guides and the FAQs and such appropriately. So if we can maybe take down the deck now so we can all see each other for our conversation, I think that would be really great.
Yeah, and then Nicole, we got a full 15 minutes for this, so I'm assuming you want to just go through it and kind of, okay, perfect.
Yep, I'm going to go back to the top here, and if you can bear with me for a moment, I'm going to look at sort of what we may have answered and what we might not have. So I talked about rates and how rates are set. I shared about the rules that were just finalized with the Administration for Children and Families. I want to go back to also how the legislature assumes savings. So sometimes they do ask the department for data, and we provide data to the legislature, and then they create their models in which they assume savings. So we did provide some data to the legislature as it relates to the attendance-based payment. And so just want to be transparent about that. The center response rates, I think that there were, when we look at response rates across regions, I'm going to have Jason put in chat actually the link to the 2024 market rate survey. And you can see in there a couple of things. One, you can see the response rates. Two, what you can see in there also, and I think Jason, when he puts this in, will tell us where to find this. Jason, if you can drop in the chat too, where we can find the rate tables so that folks can go see the rate tables. So when the center rate increases go into effect on July 1, 2026, they will be based on the 2024 market rate survey. And you can see what those rate tables will look like? Then there was a question around in 2027, when rate goes to 75%, what market survey will be utilized? The assumption is that that will be based on the 2026 market rate survey. So, and that is in the process of being finalized right now. And thank you to all the providers that participated in that survey. I want to acknowledge the conversation in the chat around, I think, some of the difficult decisions, the conversations that you're having likely within your businesses and with one another around who are the families that will continue to be able to access care in your centers and licensed family homes. And I just know that those are difficult things to be talking about, and that this shift in billing has an impact on your business model. And we don't yet know all of the implications of that. As I shared, I think I want to be very cognizant, as a cabinet level agency, what DCYF's role is, but I also know that you all interact with many center associations, licensed family home, other places where you all can have conversations about this and can connect with your legislators as well as you're navigating some of these processes. There's a question about, Jamie, I want to make sure I understand your question. Will DCYF be putting communication out about how providers can bill?
I mean, like, is this something that you're going to let families know is changing so that they know that this was a decision that providers are not making? We're not having to make changes as far as enforcing some of these attendance policies because we just want to and because we're trying to be difficult. We are being forced to make these decisions because of state funding cuts.
Yeah, so there's been some conversation around how we can communicate this with our families. And so I think we're trying to figure out what is the best way to do that. And I think some of it is, how do we communicate with existing families, and what does this mean more broadly? So that is on our, I would say, communications list around how we can do that. Just reading through here. Yeah, I see I talked about that. So when we're going to authorize care, as we always do, and a child's attendance and what that looks like is between that family and provider. And I hear the ask for us to communicate what some of the new policies are on the billing side. And so we're thinking through what that family communication can look like. Yeah, and you all are highlighting a lot of different implications from this policy decision that we will need to monitor as this rolls out. And but families don't come in a one size fits all. And you're highlighting the many things that may come up as families are going about their days, their schedules, the type of work that they do, and appreciate you all highlighting that. I do see one hand up, Jen.
Oh, yes, thank you. I'm sorry, I'm driving. I just typing would make it challenging. So I just wanted to kind of check in. So I know that you did just mention the fact that you're seeing these implications. And I think the challenging part for providers is that we are telling you guys that this is what is going to happen. And I don't think we have to wait for data for that to be true. So that is just kind of one piece. The other part that I kind of wanted to highlight and mention and just ask a question on is how are the families also being held responsible? So I feel like as providers, we're kind of taking the front end of this whole situation, and that, you know, if there's too much money going out and families aren't using the care that they should use the care, how are families being held responsible? Because if I have a child who attends my care, but mom only works 4 days a week, but she brings a child 5 days a week, you know, she doesn't need that fifth day of care, or, you know, 2 days versus 5 days, you know. So there's a lot of times where families are using our care outside of actual work needs. And as a lot of providers have also said in the comments, I don't want to monitor that, but I do feel like that should be something that should be monitored, and that should be something that should be looked at as another alternative to providers, again, kind of taking the brunt end of what's going to happen.
I agree with her as well. One of my things that I see is that the union continuously, there are a lot of educators that are seeking support, for example, with what we're discussing, right? Jen has, and I don't see much support on that end. I know that's a union thing, but as far as with DCYF, I do feel it's important for our voice to be heard, because we're going to be losing, and we have qualified educators, and lately there's been like a lot of educators that have come in um, to support families. But I also feel that our voices needs to be heard, because we do serve, like she said, families that are not letting us know what their schedule is, regardless of it being in our policies. And then we have not licensors, but um, the DCYF telling parents that it doesn't matter, it's 10 hours, then it just becomes a big mess. And I don't think that we need to be focusing so much on that rather than providing the quality care with the families. But I do feel that we should be honored with having that transparency, because it does, it is important for parents to be held accountable, and not, you know, we're raising children. Many times we have them in our care for 10, 12 hours. And we know many times parents are not there doing whatever it is that they're supposed to be doing, for the simple fact that DCYF says it's 10 hours, but then will not let us know what their schedule is.
Right. So thank you for that. I want to one, I'm going to go back to something that Jen T said. So as this legislative session was happening, DCYF continued to share the potential impacts of these policy decisions as session was happening. So I want you to hear that DCYF was sharing along the way that there would be implications from some of these policy decisions. We must now implement what the legislature has asked us to do. I think it's really important that the legislature and others hear from you as well. We will continue to share stories, but it is often more impactful when they hear directly from providers and families. I hear some of the I hear some of the tension around how families are eligible and accessing care. And I want to reiterate that DCYF determines eligibility for child care subsidy, which is a family benefit. And based on the information that is provided to the department, we determine the amount of care the family is authorized for. After that, the relationship around care access and those pieces is between the provider and the family. And providers can make policies. And so I think what I'm trying to do is really delineate what DCYF's role is and what the role of a provider is and what the role of the family is based on that business relationship at that point. So, if a family is eligible for care, they can access that care. Providers may choose to make different policies based on their attendance and some of those pieces. And I don't know, Jason, if there's anything else you would add to that.
Nicole, I apologize. I don't mean to interrupt, but I do have an example for you. So and I'm not sure if it's switching for back to 6 months, but families are approved for a year. And I can tell you with all certainty that there are many families out there who get a job for long enough to qualify for childcare, quit that job, and then continue to bring their children for a year without having a job. And it's that kind of stuff that, again, like I said, I don't want to be responsible for monitoring what a family does. But if we're looking at, budget cuts and that kind of things, those are the kind of things that also should be looked at. Because again, we as providers are providing the care, so we should be paid for our service. And it's not our responsibility to look at that family and go, oh, you weren't at work today? Come pick up your child.
And so part of what I just want to acknowledge is that 12-month eligibility is actually a federal requirement. So once a family is determined eligible, they are eligible for care for that entire 12 months. And it's also from the Fair Start for Kids Act. So I want to acknowledge the time because I know there are some additional pieces that need to happen. But here's what I want to say. One, again, just thank you for the questions. I really appreciate our ability to have an open and honest dialogue related to this. I know that there are many sides to this equation, and we're really trying to figure out, how we can implement what the state has asked us to do, continue to have access to care, and be able to tell the story of the impacts that this will have. So just deep appreciation, more to come. I know it's a challenging topic, and thank you all.
All right, everyone, and thank you, Nicole, and thank you, Ruben. Jessica is going to put the Menti link in here. The questions in the chat are also captured for the meeting minutes and the feedback loop, and so know that that's there. If you have additional questions, additional concerns, additional thoughts about the presentation, please take the time to put that into the presentation feedback link that Jessica just provided in the chat, because we do want to make sure to get all of that captured. We have a great presentation coming up right now on the monitoring survey, which is why we do have to make this transition. But that doesn't mean that we don't want to continue to capture all the thoughts and the questions that people have. So please take the time to click on that link that's in the chat and continue to add information in there as well. But thank you, Nicole, and thank you, Ruben, for taking the time to come and have that time with us today. And now I'm going to pass it off to Julie to introduce our presenters for the monitoring survey report.
Thanks, Dave. And yeah, thanks everybody for coming. And even that was a hard topic. Okay, next up, we're going to hear from Heather West, Childcare Licensing Partnership and Support Administrator, and Deanna Sunby, Quality Assurance and Continuous Quality Improvement Program Manager, who will be presenting the findings from the 2025 Childcare Monitoring Visit Survey, which is distributed to providers following their annual monitoring visit. The presentation will highlight key trends, insights, and areas for improvement identified through provider feedback. Thanks for being here.
Thank you, Julie. It's definitely a pleasure to be here finally to share these results. I know a lot of people have been curious about what these surveys are collecting, or what this survey is collecting, and what has come out of it. So today's the day we get to share that valuable information. All right. So what is this survey about? What's our purpose? So over the years, licensing has always wanted to have better insights and better understand how we are doing, and also find ways to seek, input from providers. One challenge we've faced over time is having limited resources and also having limitations on systems to help gather that information. So we are at a place where the team that Deanna and I, and even Brett and others are on, where we can do that. And so in 2024, the licensing division created the Child Care Provider Survey. And the intent was an internal tool for us in licensing to learn from licensed providers about their experience during their recent monitoring visit, and also with childcare licensing engagement in general. So this was all in development in 2024, and the survey itself began in January of 2025. So our purpose was really to create that transparent feedback loop where we can learn about practices that are going well. We want to know, what could we continue doing, right? That's going well. What could we learn and spread across other teams in licensing to say, yeah, this has been really helpful, and providers find that this is really helpful to support them. We also want to identify what needs improvement. What are areas that we can make adjustments in to do better and to be better supports and provide better resources. And we not only want to know about what we can improve or do better now, like just today, but also long term. What are some of those long-term improvements that really could have positive impacts on the provider community in our work and partnership? So today we're going to present on what we learned from that survey data. And on the next slide, we'll just go through some of those basics. So who did we survey? So following an annual monitoring visit, our Walk Compass system will generate an email message, an automated email message that has a survey link to the primary contact that is listed for every provider. So for family homes, that went to the family home provider or the owner, and for the center, school age, and outdoor nature-based programs, that email also went to the primary contact who was identified by that provider. The period of collection for data that that this particular survey and these results today reflect is between January 1 through December 31st of 2025. The survey was offered in different languages. It was translated into Spanish, Russian, Chinese, Somali, Tagalog, Vietnamese, and Ukrainian, in addition to English. And the survey allowed a completion time of about 60 days after that monitoring visit took place for a provider to respond. So we found overall, most people completed that survey within 30 days of that annual monitoring visit. So the survey response was actually pretty low. We received a 6.19% response rate, and which is important as we look at the results today to keep in mind that it is considerably low and it may not fully represent that broader group or that the views of everyone from the provider community. In total, during that 2025 year, there were 5,509 licensed providers who received monitoring visits. So those were every one of those providers received an email with that survey link following their monitoring visit. And out of that group, we received 341 providers who completed the survey. So it's also important to keep in mind as we look at and get into more of this data is that of the 341 providers who completed the survey, some people didn't answer all questions, right? So some questions were answered, some were not answered. So in each slide, you will see the total number of people who actually responded to that particular question as we review these individually. And then those percentages and totals, again, will reflect how many people responded to that question. So with that said, we'll get into looking at that data. And even though it is still a small response rate, it's an exciting beginning because it still is a great tool. And that feedback that we received, it still provides great and valuable insights into opportunities where we can improve and also learn from what is going well. Okay, so question 1 was, what is your childcare license type? So as you can see here, most of the people who responded were family home childcare and also childcare center providers. So we had 49.5% representing the family who answered this. We're representing family home childcare, 46.15% for childcare centers, 4% for school age, and outdoor nature base was a little under 1%. So we had 299 of that 341 people who answered this question. And I'll pass it over to Deanna.
All right, we'll go on to question 2. And question 2 says, how long have you been licensed to provide childcare services? Respondents reported a wide range of experience. A little over half of those who responded to this question have been licensed for more than 10 years. The largest group represents 22. The next largest group represents 22% who have 2 to 5 years of experience, 19% 5 to 10 years, and 8% have been licensed for less than 2 years. This is important information to gather so we can better understand who the responding population is. Since over half of the respondents were seasoned providers, they provide historical insight, long-term transition experience, and it also signals operational health within their facility. Question 3, did the child care licensor clearly explain the purpose of your most recent monitoring visit? We had 305 providers respond to this question, and overwhelmingly, almost every single one said the licensor did explain the visit, which is great. Question 4. If you did not know the licensor, did they identify themselves and show identification? We had 273 providers respond to this particular question. 62% said yes, 37% said not applicable, and just about 1% said no. We also recognize that some of the provider community may feel uneasy or perhaps get skeptical when licensors knock on the doors of the facilities for visits and inspections. We want to ensure that all DCUF personnel are showing appropriate identification when at childcare provider facilities. And at the same time, we also know that providers might have answered not applicable, since some likely have established relationships or know the licensor already. And question 5, if there were issues of non-compliance, were they clearly explained to you? 271 childcare providers responded to this, with 79% responding yes, 18 responded with not applicable, and just about 3% responded no. So question 6, did the licensor offer technical assistance or TA during the visit? 266 respondents replied to this question. To clarify more about this particular question, we hope that folks have heard of the term collaborative compliance. Collaborative compliance in the licensing division refers to our approach to use a strength-based approach when providing technical assistance and working with providers to identify the personal ways that they will comply with the Washington State Administrative Code while meeting the unique development and cultural needs of children and youth in care. And also with that term, we want to support providers and connect them to resources, knowledge, and assistance. We also know that based off of this small sample, it might not be a term that everybody in the provider community is familiar with. So we will also link to the collaborative compliance resource that's available on the DCOF website, so folks can have that. Then for question 7, this coincides with question 6, and to partner with it, we have an array of resources available, and we want to understand which of these folks are comfortable and familiar with accessing. So 265 providers responded to this particular question. So from licensing standards, health guidelines, background check processes, curriculum and training needs, special needs supports, behavioral tools, grant information, subsidy programs, and others. The goal is that all providers feel comfortable accessing all of them. 86% or 227 providers said they were comfortable accessing 3 to 4 of the listed resources, while 14% or 38 said they were comfortable accessing 2 or less of the resources. And question 8, on a scale of very poor to excellent, how would you rate your workers' respectfulness towards your cultural practices? 266 providers responded to this question, with 226 responding excellent, 37 with good, and then we had 2 for poor, and 1 for very poor. And the intent of this question is to gather feedback on how licensing staff assess compliance in a manner that's respectful of providers' cultural practices, communication needs, and accessibility requirements. And I'm going to pass it back to Heather for the back end of the survey questions.
Hey. So question 9, we asked where were your language needs met during the visit? So out of the 266 people who did respond, 100% replied with either yes or non-applicable. And the next question asked, did the licensor answer any questions about Washington Administrative Code or WAC that you had during this visit? We had 261 providers respond, and 84% said yes, 4% said no, and 12% said not applicable. So, kind of going back to 2024, when we were in the process of developing the survey and looking at what we want to learn from this, the licensing team identified different categories where we really wanted to, that we wanted to know more about. And so this slide represents those key themes that we were looking for. And the question that was asked was thinking back through the duration of your childcare licensing experience, can you describe a time where you were provided outstanding service or had a positive experience from a member of the licensing team, and what happened? So for this question, we received 195 responses that fell into these different categories. So around professional and knowledgeable interactions, we received about 44% that fell into that kind of group and that theme. And this theme represents comments around clear communication, helpful and patient interactions, and also licensing staff who were resourceful and thorough in providing technical assistance. So while most of those responses, really the majority of them, provided a lot of positive comments about in these areas, we did receive some comments that highlighted areas for improvement as well. And so approachability. This was the we received about 29% of the responses shared comments that fell into this category. And this theme really represents whether licensing staff were easy to approach, to talk with about questions, to engage in conversation around challenges and questions. And whether the, I'm sorry, let's hear. Yes, and also was the interaction welcoming? Were licensing staff approachable? And that doesn't just go to the, so the question, as you can see, it's very open-ended. It doesn't really tie just to a monitoring visit. It's really whether it was a phone call to an office, somebody who stopped by for a visit, or any type of interaction. This is where we were looking for our licensing staff approachable. Another theme is cultural sensitivity and respect. We received 3 comments that fell into this category. And this theme represents interactions that respected cultural and religious practices, honoring diversity, honoring first languages by coordinating interpreter services to support conversations. And we received a lot of comments that did speak about the licensor's approach. And we received a few comments that also specifically called out how they were appreciative of that interpreter service or of the licensing staff who also were able to speak that same first language of the provider. We also had finally another category titled Process and Trust. This is the group, or this is the category where the majority of these comments fell under. In fact, we had 133 comments that represented 68% of who responded to this question that fell into this category. And this theme represents comments that spoke about the trusted relationship and that connection between the licensors and the providers. Comments that were shared, they spoke about transparency, timely responses, clear expectations, and community impact also fell under that theme. And it is noteworthy. We did receive a few other comments that really they responded not applicable or were left blank. So we had about 14 that had that response that we weren't able to kind of put into any one of these themes. But overall, the providers that answered this question and participated in the survey responded very positively. And also, we did highlight some, like, as I mentioned, areas for improvement. Yeah. And then just to give some examples, this next slide, we had a few quotes that just to give examples of what kind of matched with those different themes. So for professional knowledgeable interactions, one individual commented that they appreciate the licensing team for their support and clear communication. Their guidance has helped me grow as a provider and continue improving the quality of care in my program. Under approachability, someone commented, my teachers commented on the positive feedback they received from the licensor. Cultural sensitivity and respect. Someone shared, I have had good experiences with all of my licensors. They talk to me in language I can understand and work with me to problem solve things that need to be addressed. My current licensor has been extremely helpful in answering all of my questions. And finally, an example in process and trust. Someone shared that they enjoyed the visit and they hope upcoming visits with their new licensor are just as comfortable as the one that they had on that day. And over to you, Dan.
All right, and then question 12, thinking of your experiences over the last 12 months, how would you describe your interactions with childcare licensing staff? And just for a quick overview, and we have quotes that I think we're planning on putting in chat, or it looks like Jessica put the complete presentation. 165% of these folks replied with excellent. 86 folks said good, or I'm sorry, 87 said good. 10 said poor, and then 4 said very poor. And question 20, or I'm sorry, question 13. And this is the last question, but if you have any additional comments, please share them below. And same with our key themes. 63% of folks shared positive comments. 17% commented comments were neutral, and then 20% shared negative comments that highlighted areas of opportunity for improvement. And then Heather, I'm going to hand it back to you to wrap it up, I think.
Okay. So the areas of opportunities for improvement, they really fell under these main themes here. So what we heard was some providers commented they would like more opportunities, not just at the monitoring visit, not just when there's a complaint, but other opportunities to engage with their licensor, have conversations around all things. And it's definitely something I can tell you from working many years in licensing. Licensors love that piece of it. They love, and I did too. I mean, I was a licensor for many years as well. Engaging in those conversations where you can provide more technical assistance and support. Sometimes time is the challenge. Time's the biggest challenge of some of those additional visits, but licensing staff really do also enjoy those opportunities to help, answer questions and just have that connection. Timely responses and phone calls. Timely responses around phone calls and emails was also an area that really was highlighted. Some commented about not hearing from a licensor about their question or reaching out and receiving a response much later. And also that tied with that, having clear communication about who their licensor is, who their sign licensor is. Some providers said they were unsure who was presently assigned to them. And another person had commented that they experienced meeting a new licensor during their monitor visit, and there wasn't a notification or any communication to relay that there had been a change, even if it was due to turnover, right? Due to turnover in the local licensing team. So that was an area that we learned about as well. And also around improved communication about noncompliance at the time of visit so there are no surprises when the inspection report is received. So we had a couple providers make comments that said items appeared on a written inspection report where they were not discussed on the visit, so they were a surprise. So that's definitely valuable feedback for us to take back to teams and also share. All right. Okay. So what are those next steps? So that first year, 2025, that was the first year of our data collection cycle. And at the time, we scheduled it to follow the calendar year. But moving forward, one of the changes we will be making this year is that we will align that with the fiscal year that we follow, and that the childcare licensing monitor visit follows, which begins on July 1. So for next year's results, they will be reflective of July. Actually, they will include from January 2026 through June 2026 and that full new year of July 1, 2026 through June, end of June of 2027. We'll go back a bit to the last slide. So going back to that significantly low response rate, right? We want to increase that. So we also identify and looking at that, well, maybe there's some areas that we need to make improvements around so we can increase that response rate. We identified maybe some of the questions, how they're phrased, how the email message that goes out to providers after that monitor visit. Maybe we could make some changes so that our purpose is clear, so that people understand what that survey is about. As we identified those as areas that we want to look into and create engagement around to get feedback from people. So to do that, we want to learn from providers. So Deanna will be, some of her next steps will be to engage with not only providers to hear how are these questions, when you see these questions, is it clear? How might we rephrase them so it is clearer? And also looking at that messaging as well. And also including licensing staff too. So we want to get perspective from everybody when we're going to make these meaningful changes. So in the months ahead, Deanna will be working on that engagement and seeking feedback. We also want to look at how might we help spread the word a bit more, right? Promoting the survey. How can we help spread the word of what this is for and how we're using it, how we're using it to learn about our practice and where we can make meaningful changes. So even with the response rate, you might recall just a few slides ago, I talked about who that email went to. So that email after the monitor visit goes to the provider. It goes to the primary contact. But what came up was that the person who received the email may not have been the person who was working with the licensor at the monitoring visit. There might have been somebody else there throughout that whole visit. And so we want to also explore how can we make sure we're getting the feedback from the people who were there at that time. So it might be a factor, might not, but it's something that we definitely identified we want to look into. And kind of around that spread awareness, this is where we also want everyone here in the audience, your help too. So not only complete a survey if you receive it, but also help spread that word to your colleagues out in the community to complete that survey as well and share what it's about.
So I have a question. Sorry, I can't find the raise hand thing on here, but it's been gosh, almost a decade now since providers started asking for a survey. And I'm a little concerned that this doesn't reflect all of the intention of why we wanted a survey. I don't see, well, for one, there's a lot of concern about it being anonymous. Logging into Walk Compass to fill it out doesn't make us feel anonymous. So that's a concern. But the intention of why we wanted a survey was really to communicate when we were having issues with our licensor and making sure that if a region was experiencing kind of widespread issues with a licensor, that it was easy to be identified through a survey capturing that, oh, region 2 is really having a hard time because look at all these negative comments in all these surveys from region 2. So I don't see anything that identifies the region or even the licensor at all. Hey, Trav.
Travis, would you like to?
Yeah. Yes, you're right, Julie. That's not the purpose of it. If we have issues that are going on and things are not consistent, we have a way to elevate those issues, right? We have supervisors, we have or area administrators, Debbie Groff, myself, Ruben, all the way up to Tana. We have a process to deal with those. What this is that we want to get feedback of how we're doing and give folks a chance to give that feedback after they've seen us, right? And that we can collect that and see how we can do a better job. It's about improving our practice internally, really what it is. Now, if there are issues, right, that you're describing, right, though there is a process to be able to deal with those. And we need to continue to do that because if there is something going on and we have a licensor that's not doing what they're supposed to be doing, we want to be able to correct that, right? And so that's why we can't do that through this survey, but we do have that process internally. happens all the time.
I mean, it's a little frustrating. That is what providers were asking for in a survey for a long, long time. We kept hearing stories of, and I know I keep saying Vancouver, I don't even know what region they are, and I'm sure they're all worked out by now, but
But
ancient
Julie,
history, we had heard that there had been so many unknown issues, like people weren't even aware until providers started getting together and sharing these stories. And we were like, there has to be a way for a survey to capture this so that licensing knows right away when there's an issue in a region.
and we do that. Those get escalated, and that's how we deal with those things. Yeah.
I think you have to have a pretty vocal, assertive director to escalate issues. And so I think
we have plenty. We have plenty. Trust me.
Which,
I
Travis,
think
that's
we're outnumbered.
this is a great segue for the next slide, actually. So let me share a little bit more on how you can go about doing that. So you're right. I'm right. How do you share feedback? The intent of the survey is to collect how are we doing and what is that experience like during a monitor visit and our engagement. So on the next slide, it also highlights what are other avenues where you can share feedback. So as Travis mentioned, one of the best ways really is in the local teams. It completely understandable if there's a concern that comes up and someone's made attempts to communicate with a licensor or has feelings about that. A next step could be to contact that supervisor in the local office or the area administrator. And really to help resolve that concern with a program or questions about something specific to your program or your site, that really is that best avenue to explore. And of course, as Travis mentioned, even beyond the area administrators, Travis or Debbie are also available. Um, and that also, we have had people say, how can I even share not only a concern, but a positive about it? Like, this was really great. I really appreciated this or something, whether it's a practice change, right? Or something other. The same thing, reach out to local or regional teams to share that feedback, whatever it's about. And so then if there still remains an issue, that, options have been explored to handle it locally. If the feeling is that, yeah, nothing's changing, I don't feel I'm heard, then the next step could be also our DCYF constituent relations team. And these are hyperlinks. These are hyperlinks, and I don't have them available directly, but they are hyperlinks to the slide that I think Jessica, did everyone in the audience receive that? Or it's in chat? We'll get that. But the hyperlinks can bring you both to, in that first block, who are the local contacts? If you don't visit it often, might be awkward to find where that site is. So this link will give you the entire listing of our licensing offices, the area administrators as well, and contact information. That middle block, it provides a hyperlink also to the constituent relations webpage. And also just want to encourage, if there is a topic that's not site specific, but it's more of a broader topic that you'd like to address for meaningful change, this is a perfect group, right? This is also a perfect forum to bring that topic to for discussion and engagement. So wanted to share those other options in case some you might not have been aware of.
Heather, one of the things on the local office website that we've talked about for a while is can you, or not you, somebody, provide what cities are served by each office? Because that can get really confusing. People go in there like they don't even see the word Seattle in there. And so I just wonder if there's a way to be able to say this office serves these towns. This office serves these towns, whatever. And I know you can't list every town in Washington, but it can give a general idea of which office people are actually supposed to communicate with based on where they're located.
Yeah, we'll definitely bring that request forward and see, I don't know, what we could do or how we could better, maybe it's a map, that you could just select where you're at or enter a zip code and then boop, this is your office kind of thing. I'm not sure, but we can explore that for sure. So I'm just looking at the time, Dave and Julie. We have 2 minutes left. I think given the time, do we want to just collect the questions and then respond back in the feedback loop?
I think that's fine, unless you see an easy one you want to grab real quick.
Oh, the last one that I just at the bottom, does pre-licensing have a similar survey for new providers going through that process? I don't believe so. Travis, do we have one for the application process?
Not at this time.
Right.
We've talked about implementing that. We're still doing some updates on the pre-licensing. So it's on our list, but no, we currently do not have that. People are finding a way to give feedback though on pre-licensing. I can tell you that because we've received quite a bit, both positive and some areas of concern. So yeah.
And Janelle, you have a question about the no response answers if they were looking at that. Yeah, absolutely. We want to make sure that every question is clear and we're people don't have to guess like, oh, what are they asking? Or should I say this? Yeah, we definitely want, and also maybe no response or even the not applicable. Maybe we need to add a couple responses so that we can better capture, oh, I knew my licensor, so they didn't, whatever. Why was it not applicable or why did they not respond? So absolutely, we definitely want to look at those for the revisions. So thank you all. We'll review your questions and get back to you.
Yeah, thanks. Good topic. Lots of good questions. Thanks for coming, everybody. A lot of presenters today. We had a lot of information. We've got our next meeting on Wednesday, July 15th. There is a link on the website where you can register for the upcoming meeting, and maybe somebody can drop it in the chat. But anyway, the Menti is already in the chat, so you can provide feedback or questions on any topic that we've covered, that has been covered today, and it will be compiled and sent out before the July meeting. But thanks, everyone. Have a great day.